What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com. is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com. What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com. What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com.
they're playing with other things, yeah, they don't pay attention.
Well, I try to at least make eye contact because I know they have to do it, and they're not thrilled, so I try to make eye contact. Well, they always pull down that oxygen, that O2 mask, right? And then one of the things that they say every time is, if you have a child with you, be sure to put your mask on first, and then take care of the person that you're with. Which, I know the first couple of times I heard that, I was like, no, I got to take care of the kid. And the logic has, has come clear to me as I've gotten older that I can't help people if I'm not good, right? You guys run into that.
Absolutely, all the time.
Yeah. Yep. If we're not good, or if the family is trying to take care of mom and the family's not good, or the spouse.
Will you guys reintroduce yourselves again?
Oh.
It didn't record, so just that part.
Oh.
Just the very beginning.
Yeah.
Oh, good. So we get to start over?
Mm-hmm.
If we're live, if you're watching us live, you're not losing your mind. Just so you know. We're going to start
It says volume's low.
over.
All right, well, again, it's the second day of the No Place Like Home Conference, and we welcome you all here today. My name is Mike Briggs with Keystone Hospice, and I'm your moderator today for the topic, O2 mask on first. And sitting to my left is Mr. Mark White, the founder and president of Idaho Estate Planning. Mark is passionate about helping families plan for their futures. Mark has a degree in philosophy and environmental studies from Utah State University, I'm getting ahead of myself, and a law degree from the J. Reuben Clark Law School at Brigham Young University.
That's a mouthful.
It is.
Yeah, but
say that faster.
We kind of, sometimes for certain people, we want to make sure that Brigham Young University is, minimized a little bit. So that's why we say that.
Because Mr. Reuben is the man.
Yeah, well, he was kind of incredible.
Yeah.
So they named the school after him, but it is in Provo at BYU.
An expert on estate and legacy planning, as well as asset protection and tax planning. He has co-authored several manuals for attorneys in the areas of probate administration, estate and estate tax planning, and asset protection. His book, Get Real, Planning for Life, Death, and Disability, is available on Amazon.com. Mark is also an often requested speaker and facilitator on the same topics. Mark and his wife of 41 years reside in Boise and have 6 children and 5 grandchildren.
And we used to have a little yellow dog, part lab, part golden retriever, and we lost her 2 months ago. It's been kind of quiet around the house without the dog. She had one superpower, and that is she had incredibly silky soft ears, and she would let you pet her. And whoa, that's, they have those service animals.
Yep.
She was an emotional support animal, poor kid. Anyhow, we miss her, and my wife looks every night for another dog.
Mm-hmm. Well, we recently lost our dog of 10 years too, so
Oh.
I feel your pain. I understand. It's tough.
Yeah.
They're part of our family. They're an important part of our family.
Yes.
Well, let's get started here. O2 mask on first. What is estate planning?
It's interesting because I get asked that quite a bit, and folks are, I don't know, I think in most people's head, when we talk estate, we're thinking Downton Abbey and this huge house, and they close up the West Wing in the winter, and whatever, and so people go, well, I don't have an estate. Well, under the state law, we go to what's called the probate code, and the probate is the provisions of the code that govern what happens when you die. And in there, the probate code uses the term estate, and estate, that's everything you own, including debts. At your death, that's an estate. And so when we do estate planning, it's not just for people with the big house in England or Downton Abbey or, you know, big landed house in northeastern United States. It's everybody. And so when we talk about planning, I wonder sometimes if we should call it people stuff instead of estate planning, because we all have stuff and we all have people. And so we're trying to match those two, and what happens when we're gone. You know, do we want to take care of a spouse or a significant other? Do we want to take care of the kids? And what are the best ways to do that? So that's kind of the nub of what estate planning is. We add into that, though, because over the years we want to make sure that if you were incapacitated, what happens?
Yep, it's very important to know.
Yeah, well, who's taking care of your stuff, and, you know, are they managing it for you, and what do you want them to do? So all of that kind of rolled up anymore into estate planning. And it's really, the nub is pretty straightforward, but people, you know, people are different, everybody's different, everybody has different stuff and different goals and different families, and so it can get pretty big out there, and people get a little bit lost going, you know, if they do understand estate planning, they get a little bit lost, and then there are those that go, I don't have an estate, and the answer is, oh yes you do, and so that's estate planning.
And it's so important. We work with families every day, and sometimes families didn't do any estate planning, and it's messy when there's no estate planning. So I'd advise everybody to make sure that you get your estate planning done.
We call it, if I may, we call it planning by design and planning by default.
Yep.
And
I've heard it many times.
yeah, well, the default is what you see.
Yep.
A lot of. I didn't do anything. And so in 1974, our state legislature said, well, we got to come up with something because there's so many people that haven't done anything. So you can go to the code, the probate code, and it tells us what's going to happen with your stuff and for the people. And most people don't like that plan.
So your family that's left behind, they're going to hate that one.
Yeah, they don't like that plan.
They're going to hate it.
Yeah, and so you can either, as you said, you know, you can either be in charge and plan by design, or you get that default plan, which, you know, they just kind of slap it on for everybody. And I got an interesting call. I'm going to do this all day, so get used to it.
It's all good.
I got an interesting call from a little gal who, she and her brother were adopted by their grandparents. And the uncle, and grandma and grandpa passed away, and the uncle has begun the probate process, but he has listed only himself as an heir. Okay, I'm just the only one here, which is wrong, by the way. Those kids, when you're adopted, you are now the blood.
Absolutely.
And so he's wrong. We'll have to see where that goes. But again, that's the default. And then, you know, a lot of people with stepkids that want to take care of the stepchildren. Under the probate code, if you don't do any planning, stepkids are out.
They're done,
Yeah.
yeah.
So, you are exactly right. You really should sit down and decide how you want it to look.
Yeah, because when you can design it, you're in control before you pass the bill. And it's a big deal. We come into contact with people, not only in our work, but also in life, that we suggest that you get your estate planning. You got to have your affairs in order, because you could get in a car wreck tomorrow, and then what's going to happen with your house that you've had for 50 years, and you know, what's going to happen? Well, probate.
And most people don't want to do that. I'm just telling you, you're not going to believe me. You're going to say, no, it's going to be all right. And I'm just telling you, yeah, maybe. But we attorneys will make a bunch more money. You're going to have an accountant that makes a bunch more money, a personal representative. It's just quicker, easier, nicer, sweeter if you have a plan in place.
Absolutely, 100%. So how can estate planning help you take care of a loved a loved one during a medical crisis?
There's a number of ways that good planning can help you get through that process. So one of the first things is, at least for us, when you do a plan, what we're talking about is everything. Who's going to make decisions for me? If the time has come, I don't want to be here, or I do want to be here. I want to be plugged in, or I don't want to be plugged in, and I got to have somebody that can make that decision, and I got to tell us who that is.
Yep.
And so there's the part where we're going to decide who's going to step in. Very often it's a spouse. You know, I would have my wife do it, and then often it's one of the kids. Sometimes maybe the kids are too young. Maybe the kids maybe don't agree on stuff, and so maybe that's not the best choice. But part of the planning is to sit down and anticipate that situation. So there's who's going to do what, who's going to do it, and then there's what are they going to do. So if it's a crisis and maybe the brain waves on little scope aren't popping up and down, kind of like when we were teenagers.
No,
It didn't pop very far.
I didn't have it. Yeah.
Oh my. Oh.
Bad decision after bad decision with my mom.
That's how we learn.
As a teenager.
Yeah, that's how we learn. That's how we make good decisions now, so we remember.
Yes.
And so if I'm in that situation, or it's a terminal situation, I'm going to die, and the only thing that's keeping me alive is being plugged into the wall, then anticipating that, I can write up they call it a living will. I can anticipate that and say, no, I want to go. It's been a good run, let me go. And then I have the power of attorney for health care. That's the individual that I say, this is, Mike's going to make, he's not going to make the decision for me, but you're going to follow my wishes.
Yes.
You're going to say, okay, like right here, White, he wrote this out, this is what we're going to do. And so that's part of it. There's a couple other parts. There's financial issues. And who's going to make financial decisions? Who's going to make arrangements? Who's going to talk to, maybe we need to sign a contract to move into skilled nursing or rehab. Who's going to do that? I gotta name that person and give them authority to do that. Who's going to manage my finances? So these are all issues that most people don't think about, and I don't blame them. It's not a matter of, oh yeah, everybody every day should go.
It's so fun to think about.
Oh my gosh, yes, yeah, oh yeah. So that's.
I might die someday.
Yeah.
Or I might have a health issue someday, maybe.
No, not you. Other people. But yeah. So that's part of the planning, is to walk through that and say, here's the people that are going to make decisions for me. Here's what I want them to do for me. And then you got to empower them to do that. And in Idaho, it has to be written. Actually, most every state has to be.
Idaho, right?
Yeah, it has to be on paper, and it has to be signed and notarized on it. And so that's what we do. And that's what gets us through medical crisis.
Yeah, and again, I'm going to speak from experience. We come into contact with so many people on a daily basis that haven't done that planning. So sometimes it's really sketchy when we're trying to help families out and getting their loved one on hospice, or getting them into a long-term care facility or into an assisted living. Sometimes it's crisis mode, and it's not good.
Yeah, we had Jamie Nowlin from Ada County Paramedics yesterday, and I didn't realize how good a job they do of ransacking the house if needed, looking for those documents.
Sure.
I mean, they want that guidance. They don't want to make those decisions. They want to know, what they're supposed to do. And so, really critical to have that decision made, and then two, it's gotta be on paper, and then somewhere where Jamie and her, her coworkers can find it. And then when you get to the hospital, guess what? They want
They
that
want it too.
paperwork again. So do you guys look for that when you are, when you're out visiting with people that maybe are coming onto hospice? Is that part of the checklist?
Yeah, so part of the checklist is getting that living will, getting that durable power of attorney. If they don't have that, then our social workers will make sure that they get that taken care of. So that's a typical, yeah.
Well, that's a huge service. And so part of this No Place Like Home conference this year is aimed at the kids dealing with mom and dad.
Sure.
So if you're one of those and you're listening in, this is really good stuff to have that conversation with mom and dad, right? Kind of just, Mom, just in case, I know you're gonna live forever, but if you didn't, what are we gonna do? Dad, who's gonna step in? Do you want to be plugged in? And in Idaho, most people don't want to be plugged in. They just want to go.
Yeah, and this is hitting home right now for me. My wife had that conversation with her mom last night, and they don't have any planning right now, so they need to get it done.
So let me ask this while you're in that stage right there. You got any tips for people that, because typically you run into a little bit of pushback from mom or dad with this conversation?
Not with these two. They want to get it done.
Oh, very good.
They just need to get it done.
Very good.
Instead of saying, oh yeah, we need to get it done. They need to sit down and go get it taken care of.
Yeah.
So,
So often that's the first obstacle is to get people to go, yes, you're right, I need to get this done. And then the second thing is to help them make it happen. And before we're done today, we can talk about a number of resources that people can engage to help get that done, get that planning done.
great. So how does estate planning help you pay for long-term care?
Well, there's probably a couple of parts to this. The first one is when people come in to us, the first thing is that we ask them a bunch of questions. Just, okay, what do you want to do? How do you want to do it? What does this look like? And so then we can talk about what we just mentioned. Where are we going? The next thing is we really get into you're going to have some issues down the road. How are you going to pay for them? And so we do kind of push them to have that conversation. Now, some people won't do it.
Sure.
They just, no, just give me a will or a trust or whatever, those other documents. And then others are going, well, what do you got? Talk to me. What do you got? Well, there's some things that estate planning can do. You talked about the VA benefit, and by the way, if mom or dad were active duty in the military during a war period, okay, 90 days active duty, at least one of which is during a war period, then they can qualify for VA benefit. And what you're going to find with the VA benefit is absolute huge help with finances. That's something that you need to pay attention to. Anyhow, but to qualify for the VA benefit, there are income requirements, there are asset requirements, similar to Medicaid, which is also another benefit. So the Medicaid benefit also has income and assets. And in both cases, Congress doesn't really want you to give away assets. And that's what a lot of people, that's the first thing they ask me. I just give that to my kids. Well, you have to do it in an appropriate way, and your timing has to be just right. So the planning is, okay, what do you want to do with the house? Well, I want to give it to my kids. Okay. And then we have that conversation. Well, what if you need the money from the house? What if at some point you're in assisted living and we need to sell the house and use the cash? Well, if you give it away, that's really hard to do.
So we had this happen with my grandma. So she went to the assisted living. And at first, it was there to just rehab and then go back home. But 2 weeks into living there, she's like, let's sell the house and I'm gonna stay here.
Yeah.
So it was a win-win for everybody. She sold the house, and then that helped also with the VA aid and attendance benefit, pay for her to live there for the 5 years that she lived there.
Yeah, the VA benefit, we call it the aid and attendance benefit, is not a ton of money, but it can help.
It's enough.
Yeah, well,
It was enough for her.
Yeah, well, for a lot of people, it supplements what they already have
Right.
and makes it a lot easier. Or we've had a number of situations where dad needs assisted living, mom can be at home, but that's expensive to do that. The aid and attendance was, just helpful to make sure that they could do that.
Absolutely.
So that worked out. Anyhow, so with the VA benefit, you can give away assets, but you have to do it at least 3 years before. And with Medicaid, you have to do it at least 5 years before. I have yet to see, I'm sure it's happened, but I have yet to see where a family on their own did that correctly. And so that's how good planning, can help you to get that. So for example, with grandma, house in the trust, she needs some cash to sell the house. The cash is in the trust, and since we did it soon enough, then it's a non-countable asset. And same thing with Medicaid. So now we have some cash over here in a trust, and we've got this benefit, and the two together make sure that grandma has a high quality of life.
Yeah.
She's getting the help that she needs.
Yep, it was a true blessing, and I know I've said it multiple times, but thank you, Mark, and what you guys did for my grandma. It really means a lot to me.
You're welcome. I enjoyed working with your family. Anyhow, that's what estate planning can do to help pay for long-term care. So, just to recap, there's a ton of things you can do, but you got to do them right. You got to do them timely, one of the things that we spend a lot of time doing is educating. If you go to, I don't know the last time you did a Google search, but you put in some information, I want information on this, and you get 3.75 hits in 2.65 seconds.
Yeah.
So there's millions of sites, and all of a sudden you're trying to understand when you're gonna, how to put all that information together. Literally, there's no way to know. And so if you can go to a professional, go to an attorney, and there's a number of really good attorneys that can sit down and help you to walk through all that and kind of parse through all of that information and help you to find what fits your situation. So, things that can be done, someone that can guide you through that. I can't make decisions for you, but I can help you make decisions, right?
Absolutely.
I've given you really good information. So that's how estate planning can help to pay for long-term care. A couple other things I might mention if I can. Once you qualify for Medicaid, Medicaid is not extravagant. They don't pay for lots of stuff.
No, they do not.
Yeah, you get a $40 personal needs allowance, and $40 doesn't even get your toenails painted. That's not a lot of money. So if we can qualify for the benefit and put away some money, then the kids have access to some stuff that they can then make sure that you have a higher quality of life, and that you're getting these other things. Another way to look at this as well, and I have a number of parents that do this, I don't care about the kids, but parents do for some reason. They want to make sure that the kids get something, and I'm going, that's not how this works. But if you don't do any planning, there's nothing for the kids, and at the same time, there's no, protection for a spouse, or protection of a little bit of quality of life. So if they come in and they have to do it for the kids, I go, fine. And we've been very fortunate. The kids go, no, we don't care. I'm going, shh, plan for you, they're planning for them. And
Yep.
that's what we're really after.
For sure.
And the kids have all really been very good. You know, they don't care about getting money from mom and dad, but it'd be nice if they didn't have to come out of pocket.
For sure.
And so, you know, that's what we shoot for. And to walk through that VA system is really involved. You know a little more about the Medicaid. That's also really involved.
Absolutely.
And so that whole process, you know what, and I've run into really a lot of good folks over there at the Department of Health and Welfare. But there's only so much that they can do for you.
Sure.
And so to make sure that we're using those assets efficiently and walk through, there's the snapshot and there's the spend down and there's, you know, what can we do to preserve a few assets for the other spouse. That's a process, and that takes a long time. So, those are some of the ways that good, solid estate planning can help pay for the long-term care. I wish I could, but I can't help just out of pocket, you know, pay for it. That'd be nice.
That'd be easy.
I know you would do the same thing.
Sure.
You would help out,
Yeah.
but we can't. We mentioned that before, we're married and we'd like to stay that way.
Sure.
And so to just, you know, give money out to people is probably not in the, you know, in the best interest of a long, successful marriage. I'm just saying. I don't think my wife's watching, so I can say that.
There's wisdom in that statement.
It'll be all right.
All right, Mark, so how does estate planning help you care for a loved one with a degenerative disease?
Well, this is a particularly challenging situation because whereas someone has a stroke and they have, you know, cognitive impairment, for the most part, it's fairly easy to see that and go, oh, you know, we know what we're supposed to do and how to do that. But what if this is something that takes its toll over a long period of time? And how do we take care of a parent or a loved one who declines over a period of time, but we want to make sure that they are able to make decisions as long as possible. And so this gets really involved. I'm sorry, this one's a little bit involved. Hang on just a minute, and I'll try to walk you through some of the issues. So we have the same issues that we talked about. You know, how do you pay for this? If we've got a long-term condition, how do we manage that over time? How do we pay for it? And you know, there is the Medicaid, which is going to pay for most of this, because that's where we go. I have seen a couple of programs for, depending on the condition, I've seen some programs that can help out. They can contribute a little bit to the, you know, money to the care. But the big one in this, in addition to how to take care of somebody, this you're going to split pretty quick between them making the decisions that they can make, and them, you know, not being able to make some decisions. And so how do we make that work? We need that power of attorney, a durable power of attorney, or a trust would work here very well. And then you got to get this is some real involved discussions, because we need to know what Dad wants, and we need Dad to weigh in all along the way. And so we're talking about, is he making good decisions at this point? How do we know that? How do we determine that?
Sure.
And if we haven't planned ahead of time, this becomes very difficult. So most people, the default plan would be, we end up somewhere in their opening up a conservatorship. And we appoint a conservator and a guardian.
And that's through the court system,
And
right?
that's through the court system. Most people don't like that.
Yeah.
They prefer not to go through the court. And so we can do that on our own if we have those tools in place, such as a revocable living trust, which can then define, what it is we're going to do, and that we have that power of attorney. Now, again, if it's a one-time event, we've had particular issues, we've got cognitively can't make those determinations, that one's pretty easy. We see that and go, okay, got it. But if dad's making good decisions, and then it's harder to make decisions, and then it's harder to make decisions, and then it's harder, when do you kick in the power of attorney? When is it that we step in and make those decisions? The court would tell us that you're going to have assisted decision-making and wants you to take into account their wishes, communicate it the best you can, and then over time, you're going to help them make decisions till you get to the point where they can't. So, degenerative diseases present a really interesting situation. When I say interesting, I mean involved, complicated, difficult.
Yeah.
And as an attorney, it's really interesting. But if we have no planning, then we were going to lose control to the court. And the court's going to do a good job. I mean, they're going to do the job that they're supposed to, but they're also going to wish that you had done your planning.
For sure.
And you put that together.
Yeah.
So, a couple of other things, if I may. This is not straight up estate planning, but looking at other ways to pay for the care. We had a longer discussion yesterday about how to provide the care, and sometimes the kids go, Dad, I'm going to be there the whole time.
Not very many times does that happen.
That's tough to do.
Yeah, it's really hard to do.
You've seen that.
And we see it every day.
Yeah.
I met with a family in the hospital on Tuesday, and this gentleman and his wife, they did great planning. So I get to see it both ways. Poor planning and great planning. This gentleman was a city manager for a city, and then he worked with Cecil Andrus. So he was a pretty cool dude. Anyways, he had done his due diligence in life to make sure that he could pay for 24-hour care. So when the home care agency is saying, this is how much it's going to cost a week, he said, all right, no problem. And inside of me, I'm going, that's a lot of money.
Well, and for most people,
Yeah.
that is a lot of money.
It's a lot of money. It's way more than an assisted living.
Yeah, and
Way more.
I've only had 2 clients that were able to do that, and then did it. They had in-home care 24/7.
So $5,000 a week or $5,000 a month in an assisted living.
Yeah.
That's the difference between 24-hour care and an assisted living facility. So
Well, and either way, the question is, how do you pay for it? Some people are fortunate enough to be able to pay that out of pocket.
yep.
Most people aren't, and so
Correct.
the conversation that we had yesterday was along the lines of, well, what can we do now? Which is really kind of what we're talking about right here. Well, what can I do now to make this back end part a little bit easier? Because you know this as well as I do. The back end is not easy. It's a challenge. But how do we make it maybe a little bit easier? Well, up front, a conversation about insurance, long-term care insurance. We were with Justin Walker yesterday, who said, you know what, there's lots of different options now that we didn't used to have. And so again, in the estate planning, that's one of the things that we talk about.
Sure.
Now, we don't do that part of it, but we have folks that are good at it, and we say, okay, talk to your insurance person. If your insurance person, doesn't handle the long-term care insurance, well then let us know, we can get you connected with somebody that does. And so this is, the challenge with the degenerative disease is by the time you know you have it, you will not qualify for insurance.
True.
And so
Yeah.
this is something that, part of this is family history, you know, sitting down with the doc, understanding where you are, what are the risks, you know, what does this look like for me long term, and what should I be doing now? And the doctor or doctors will get involved in helping you to understand that. That's probably as late as you're going to be able to get long-term care insurance. That's something to then consider, and as well as the other ways to pay for it, which in my book are the Veterans Medicare, which works really well, and the Medicaid that works really well. So the two parts of this are paying for it, and then two, I want to be in control. It's most people. I want to be in control as long as I can
For
be
sure,
in control.
100%.
And so that means I've got to have my powers of attorney have to be customized to your situation so that we understand what we're doing. And then the one thing, this is interesting, you probably see this one as well, the one thing that people tend to not pay attention to is a simple HIPAA release, which is, you know, the ability to share your medical information with a third party. Now, under Idaho statute, spouse is pretty good. Kids can probably do it all right. But if you have someone other than those two groups, then you really need a HIPAA release that allows the doctor, the care providers to share that information with, you know, your power of attorney, your trustees, your healthcare, you know,
Your home health, your hospice, all those people.
all those folks need to be in on this because, as you know, you're going to put together a plan. At some point, you've got to have a plan. How are we going to work through this? And if you don't have the right people and then allow them to get the information that they need, it's going to be really tough. It's going to be really, really tough. So for when you're in that long-term situation, I can't even, the sooner the better. And the sooner is, and this is horrible, and the sooner is even before you know you're going to deal with it. And so we got to put it in place for the finances. Now, what about those other documents as far as who's going to be the power of attorney, the healthcare power of attorney? We can do those after we find out, as long as you have the, you know, the cognitive capacity to do that. And many progressive diseases, you know, we have a little bit of time to make that plan and get those people put in place. But there comes a point in time that, you know, we're no longer able to do that. And that's something that we see, not all the time, but we see it from time to time when the family comes in and it's clear that dad no longer has the capacity to make that. So, sooner, better, from the finance now, even if you don't think you're going to deal with that, it'd be great to have that in place now. And then, as soon as possible, get the rest of those documents in place. That was a long answer.
It's still good though.
Well, it's a tough situation.
It is.
Yeah, it's just a tough one. And let me see if I can say this correctly. There is some thinking that, and this is what I see a lot, that if I don't confront it, it's not going to happen.
Yeah. Yep.
I had that couple last week, actually, where they kept telling me that he's right at the front end of an Alzheimer's diagnosis. Well, you know, you don't know that for sure. But as I sat and talked to him, his short-term memory was not good. a bit further into that diagnosis,
Than
you know,
what
that
they
situation,
told.
than what they're thinking. And so that denial makes this really difficult. There was in Vietnam, this is a horrible story, except there's a good point to it, so hang on.
Okay.
Admiral Stockdale, in a prisoner of war camp in Vietnam, they found that the men under his command survived the prisoner of war camps better than any of the others.
Why?
Well, and that was what the military said. And I want to know, what are you doing? Well, they asked him, he goes, so they said, now, was it because these men were more optimistic than the others? He goes, no, they died first. They died first. They came in, they were so optimistic, and they gave up. They just flat out gave up. Well, is it the people that were pessimistic? He goes, no, they were next. You know, they just didn't do well. So they said, well, so Admiral, what were you preaching to these men that helped them to get through it? He said, we worked to understand the challenge that was right in front of us. Instead of ignoring it, instead of overplaying it or underplaying it, we sat there and we tried to understand what that was. And then we tried to understand that we were in it for the long haul. We weren't going to get out of this easy.
It's a marathon, not a sprint.
Yeah, and that's what he told them. And so they call it the Stockdale Principle, and you can read about this. And so families, I think, find themselves in these situations looking at it the same way. That is, this is tough. This is going to be hard. But there's not an easy way out. You have to prepare for the long run, not the sprint. And that is how those men under his command were. And I'm not saying that they did awesome. I'm not saying that this was a good, 3 or 4 or 5 years. But they got a place in their mind where they went, yeah, this is hard, but I can do it.
Yeah, that's brutal.
And so families need to sit down sooner rather than later and go, okay, what do we need to do? And you know what, you can do a little research and find some really good checklists about, okay, what are we dealing with? And so the one that's the most common and is it's really difficult is Alzheimer's. Alzheimer's is just really, really difficult. It's a terminal situation, and then the progression of the disease is just absolutely not fun. And so this couple that I had in, she was not about to go through this. You could tell. Well, she's dealing with it. I mean, I'm sure she'll figure that out. But you've got how to figure out the finances.
Yep.
You have to put on your oxygen mask first.
100%.
So you've got to be strong and good. And this is where that caregiver burnout, I think, comes into play. And you guys see this.
And it happens for so many people. And, some families, they say, well, I don't ever want to put them in an assisted living. Well, sometimes it's the right thing to do because you can't care for them anymore. And it's not a bad thing. It's good for him because then he's getting all of his needs met, or she is getting all of her needs met. A lot of people pigeonhole themselves into that corner, and then it's not good for anybody. And so it's really important to plan, like Mark, you've been saying, it's so important to plan because you want to live by design and not by default.
Correct.
And so it's just hard for people to see it in the mirror and say, oh, you know what, I need to do this estate planning because I'm not going to be here forever.
So again, there's the estate plan, the documents, you got to have that all in place. And there's some work that needs to go into that. The family needs to sit down and I think they have to do what Admiral Stockdale was talking about, going, you know, this is tough, this is hard, but we can do it. And especially if you got the family or other, you know, other people that are involved, they can sit, they can be involved in that and say, whoa, hold it, we got your back. We can work on this together. And then I think that if we're in this for the long haul, we also have to get to that point where we say, you know, when this happens, I don't think you can still be at home.
Yeah.
And I know that is a crushing conversation and decision to make, but it's a much easier conversation when you're not there. And you can say, all right, you know, when this happens, we need to now be looking at this. And in the meantime, if we're trying to qualify for Medicaid, we've got that planning already done. If there's a VA benefit available, we've got that planning done. And so, those are tough, that's hard. What I saw, and what I see a lot when people haven't quite figured out this Alzheimer's thing that's going on, is the caregiver burnout that's already started, and they have no idea how long this is going to be and how much worse it gets.
Yeah, there's a book out there called The 36-Hour Day.
Yeah.
Well, that's what they experience every day.
Yeah.
And so it's just like when it comes to hospice. People, they want to stay away from that. Well, sometimes it's the right and loving thing and caring thing to do is, hey, I'm done going to the hospital. I'm done going to get poked and prodded. I want to be in my own home and I want to pass away. It's the same kind of thing as, you know what, I can't take care of you safely anymore, honey. And I've got to put you in a memory care unit. I just, for your well-being, for my well-being, and then you can focus on being their spouse instead of their caregiver.
Or the son, or the daughter, or the brother.
Absolutely.
Yeah.
It all, you can put every relationship in there. But it's sad when those plans aren't put in place and then it's crisis mode. They've fallen, they broke their hip, and they go to a skilled building and they have no finances to pay for that.
Yeah.
Or they have no Medicaid, they don't have nothing. But when you can plan, when you can sit there and plan for those things, it just makes life much better and sweeter that you have that protection, that you have the plan in place so that you know that you're going to be taken care of.
Very good.
So what happens if, you kind of touched on this a little bit, what happens if someone has a degenerative disease and doesn't do estate planning?
Well, let's take that for a second. Almost the direct opposite of everything that we've talked about. We are in a situation where we're giving up control. We're giving up what we would like to have happen, even though we may not have really figured out what we would like to have happen. We're now that's past us now, and then we've got the judge or the court doing the best that they can to take care of us and anticipate what we need. And so, what does that look like? Well, mentioned it, there would be a petition for guardianship, a petition for a conservatorship. The court then retains jurisdiction over this. And none of this is cheap, by the way. Now, this is going to cost us some money to make that work, and we probably don't have a lot, to begin with.
Yep.
And so now we're using up quite a bit of that to make this happen. And then we will, if we haven't done the planning, we can still qualify for Medicaid. It's just that rather than protect assets, we will be spending them down. And as we spend them down, then that makes it so on the back end of this is even more difficult to take care of. So the design, as you mentioned before, the plan by design, you maintain control, you decide, you can customize that and finely tune it so that it works for you and your family. If you don't, then you'll go over to the court. The judge will do as best that the judge can do, but the judge isn't you. The judge isn't your wife or your kids.
That's right.
You know, Judge Beater here in Ada County does a tremendous job, but he's not you. And
Correct.
So you run into that situation. All right. Well, listen, I want to take just a minute. We're going to shut down here in just a few, but I wanted to take a minute and remember some of the folks. We have some great sponsors. And by the way, just in case you forgot, this is our second annual No Place Like Home conference. We did this last year. It went pretty well. Carly worked her tail off, so you can see she doesn't have a tail this year. I don't know.
It's gone.
Yeah, I don't know how she finds the energy or whatever to get it done because there's no tail.
She's younger than you.
Yeah,
There's how
that's
she
for
finds
sure.
it.
That's for sure. We were comparing medications that we took last night to kind of come down. And then our sponsors, Homestead and Blue Cross of Idaho True Blue Special Needs Plan. Good folks, both. We know them both. Thank you. And you can see our little chart there. This is Garden Plaza at Valley View. I've known them forever, and they do a great job. And thank you, thank you, thank you for being a part of what we're doing today. Our theme this year, and this morning we didn't focus as much because it really applies both sides, and that is the sandwich generation, as we call it. You know, somebody who's like you, got kids that you're trying to,
Raise.
take care of,
Yep.
and if not now, soon. You've got parents that you're concerned about, and you want to make sure that they're taken care of, and that's why we're talking about that. Put that oxygen mask on. You've got to be in a good place, and so. Today we're talking mainly about a little prevention, a little preparation, and things that you can do now to prepare for down the road. All right, so I'm going to cut us off early. We've got some great folks coming up, so don't go too far. Don't go far at all. And we're going to be back with you. And Mike, thank you. I haven't been interviewed for quite a while.
Yeah, the last time you interviewed me, the last time we did something like this, and I really appreciate it. And I want to thank Carly and you as well to let me be a part of this, because I really believe in what you do, and I see it every day, either in the good or the bad, just like the living by design or living by default. And it's so important to me to help people know that it's the best way to go is to live by design. Living by default, it's not good.
No, and we're going to hear more about that in just a little bit from Aaron Olson, who's going to help us understand some things that happened that we learned from the COVID and how that impacted a lot of families. So thank you. We'll see you in just a few. worry about being too close or too far away.
Yes. We were just thinking it is straight away center from you.
Yeah, back here straight up.
That's why we pushed in the middle.
No, I know you were. Yeah. I gotta say, I was quite impressed.
Thank you, sir. Awesome. Thank you. All right, stay well. Enjoy this beautiful day.
Okay.
Thank you.
Oh, okay. Nice shot, yeah. All right, guys.
What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times.
Commercial from them, great folks. And the Blue Cross of Idaho, the True Blue Special Needs Plan. And again, we're here at Garden Plaza at Valley View. It's the only place I've been yelled at by residents. They were playing cards, and me and the old man band, we were playing not too far, and they came over and asked us to turn it down. I said, well, we were supposed to be here. Anyhow, it was a long story, but it was a lot of fun. So we're going to talk about now perhaps some things that we learned or maybe should have learned during this COVID thing, which, you know, I would love to be able to sit here and tell you that we're past it, it's done. I am not getting that feedback from anybody that we're done and that we're past it. But are there some things that we could learn from it? Especially for, you know, mom or dad or some of our older folks. I know that my mom struggled, so you'll probably hear about mom's struggle as we talk today. We have two awesome guests with us today. We've got Aaron Olson on the Idaho Commission on Aging, who, as near as I can tell, does everything over there, right? Did I get that
Not
right?
even close, but.
Oh, well, there's the disease prevention and health promotion, homemaker chore and transportation. Those are 4 programs that you manage.
Used to. We made a little bit of a shift, so I'm
Okay.
still doing disease prevention and health promotion, and I have taken on the Aging and Disability Resource
Oh, very
Center,
good.
which is absolutely critical for the types of things that we're talking about and making those connections so that
Excellent.
people have an easy one-step way to get the
Oh,
services.
very
they need.
good, very good. Hopefully you will infuse your comments today with how to access that, because that would be awesome. And, oh my gosh, 2 master's degree in education. You founded and managed PC Keys Technology Solutions, and you did that for 26 years.
Yeah, prior life. Seems like at least, but it all comes around.
Okay, so you've been with the Commission on Aging since 2017. And it says here, I love this line, where she is able to utilize her varied background, interest, and skills to develop and manage programs that promote interventions to assist Idahoans in aging successfully. And I think that's right. You have such a varied background and interests. I love it. I love it. And so one other line, and this is what we're going to do today, is address factors that impact how older adults can stay healthy, stay safe, stay informed, and stay at home. And letting them decide what home is for them, where they would like to be. So awesome. Thank you for being with us today. We're going to ask you a bunch of questions.
Good. Hopefully I'll have a lot of answers.
Okay, well, you know, the 3 of us will figure it out. And Kathy Lucina, who we've known for a long time. Kathy, always good to see you. Thank you for being here.
You're welcome.
Community Outreach Specialist for Oasis Senior Advisors. Okay, so in a minute I'm going to ask you what that all means, but you've been in this industry for a while.
I have.
Every time I run into you, you're always upbeat, very energetic. She's on drugs.
You can't say that.
Oh, I can't say that, I'm sorry. No, just take that out.
High on life.
And coffee?
Oh, yeah.
And then you've worked with the senior living communities, and you've done a good job with that. That I know. You were the sales director at Rebel Eagle,
I was.
and I think that was a lot of fun. I think you enjoyed that.
It was interesting.
It was interesting, we'll leave it at that.
It was during the COVID.
Oh, yeah.
Yeah,
Oh,
so-
yeah.
Yeah, fun is probably not the word.
No, it was hard work.
Yeah, it was.
Yeah, oh my goodness. Well, we're going to talk about that a little bit. And you've been on a bunch of committees related to senior care in the Treasure Valley, the IGFA, Idaho Guardians and Fiduciary Association. And I believe I'm doing a presentation there next week on powers of attorney. HAPPEN, I know you've been involved, HAPPEN, the Idaho Continuum of Care Alliance, and LEARN.
Yes.
And LEARN is a newer thing,
It is.
and you folks are working hard to get people educated. Aaron, I think you recognize this as well. there's either a very little information that you can find and is worthwhile to you, or it's a fire hose.
Yes.
And to sit down and parse out, you know, the really good stuff is difficult to do.
Absolutely.
And so Kathy and folks are working on that with Learn, the idea of being able to give out that kind of information. That's what we're hopefully doing here. And again, you should get your notebook out, take notes. There's good stuff here. There's going to be a lot of information that we weren't going to get through today, but we're recording this. You'll be able to see it again. And then probably knowing these two, you may get a reference or two that you can go look up. So, let's start with quality of life, because I know that the COVID thing was a real challenge for a lot of folks of a certain age, our seniors, if you will. Tell me a little bit about the challenges. What did you see? So, Erin, why don't you start?
We saw everything. I mean, we continue to see everything. And, you know, the first thing I always like to remind people of is quality of life is a different concept for every person.
That's true.
And we have to be respectful of those types of things. And that's why we say aging in place in your community of choice. Those are two things that are critical for that, because it's not the same for everybody. In some of the prior sessions, people have talked about, you know, do I age at home versus in a facility, and how we have kind of in our heads that a facility is bad. But a facility may not be bad if it can take care of the things that are not being taken care of well with home care.
Well, I remember as a kid, that as like Cub Scouts and Boy Scouts, we'd go do programs and stuff at the home in our community, and I didn't like it, you know, because it was, one, it was foreign, and two, I'm just this kid, and I'm used to my home. But, you know, I kind of came away with, well, it smells, and it's, you know, really austere, and, you know, and they were like that.
Mm-hmm.
But they're not that way anymore.
No.
But I still, that has settled in, hasn't it?
I grew up with that stereotype and actually worked 30, dare I say, years ago in facilities that were that way.
Yeah.
Good thing is they have changed. We do have a lot of opportunities for people to have a more home-like setting while they're still getting skilled care.
Well, and so Kathy, I'm going to serve up the softball here for a second. We get a lot of parents, grandparents that remember that home, you know, in the home, and they make their child raise the right arm, you know, put the left hand on the Bible, and you swear never to put me in a home. And unfortunately, a lot of kids do that. So Kathy, give us.
Yeah, they do, and it's well intended, and at the time that it's being said, there really isn't any reason to think that can't happen. But as we all know, you know, life changes, and as we age, time does things to our bodies that kind of reach that point where it just doesn't make sense anymore. And a couple of things that really kind of drive that need to make a different choice is, one, when they're no longer safe.
Yeah.
Where they are.
That was, you'll hear about Mom, and
Right.
She had some falls, and she actually did okay, but it scared the heck out of the kids, right?
Yeah. Another factor is when they really aren't living independently. They're in their home, but they have services for everything. You know, their meals are brought to them, maybe fed to them, you know, so it becomes a matter of, are you really independent? Then lastly, and as importantly, is in some cases they're not socialized.
Oh, goodness.
They're
no.
by themselves.
Yeah.
All they see is a caregiver that comes and goes, but they have no one to talk to. They're lonely. Maybe they're even suffering depression. So those are the kinds of things that kind of force that adage of age in place needs to be
course, is one of the biggest things that we have, and it's not new, but we've had magnified with COVID. When there was the lockdown, people weren't able to come see people. And we realized perhaps that our networks were there, but not always accessible. And we didn't know how to get them accessible. And of course, that brings in the whole topic of technology and the technology gap. But loneliness and suicide even, especially in older adults, is a significant concern, and those numbers have come up dramatically in all of the behavioral health issues with COVID.
Yeah,
That's quality of life.
It is.
yeah, and that's not surprising from what I've seen. Again, as you say, it's different for different people, but, you know, I talk to Mom a couple times a week. She has 7 kids. We all talk to her, you know, fairly regularly. She's got a bunch of grandkids, but it was not the same on the phone as it was sitting in her apartment, you know, giving her a hug. That was a real challenge. And it seems to me, maybe one of the things that we pulled from that is, as we work with Mom or Dad, and we're making some plans, that ability to give them a hug, visit with them, I think that just, I think maybe we learned, well, we took it for granted before, I think. And then when there was the lockdown, we came face to face with it.
You don't know what you have until it's gone,
Right.
something like that.
I know
Somebody
that
said that at some point in time.
Don't get us started. Don't get us started. We'll start singing. So I think another thing, I'm throwing this out, hopefully throwing you lobbing some over the plate that are hard to hit. Loneliness, isolation, depression. Again, I don't know that folks understand that when they make these pronouncements. I'm going to live in my home. Anything we can do about that? How do you think is there something we can do to approach that?
There are, and Commission on Aging and our area agencies on aging, that was one of the first things that we did. We implemented a friendly caller program that reached out to anybody that we either already knew of or that we could find. It was that touch point because a lot of older people don't necessarily have family to care for them. And when you're locked down, nutrition and food, of course, are your first two things that you have to worry about before anything else. And so we get people fed, we make sure their medications are right, but then there are all of the other things that include isolation and loneliness as well. Just having a phone call can work.
Well, I thought that it was huge for Mom, but you know what? It still wasn't the same as the contact.
Yeah.
I imagine that's the same way for most people, but there's a few that don't mind.
I didn't mind. I have to tell you a personal story. I am one of those people that I'm just happy as a clam to sit at my desk, head to the grindstone 10 hours, and I don't want to say not be bothered. I love my colleagues, but I do well that way. And because I did work from home for a lot of years, it was not a big change for me. But I watched other people who really struggled with oh my gosh, I can't go to my weekly coffee with the guys or whatever it may be, and they didn't know how to do it, and of course they missed it. But I do have to say, let's say 6.5 weeks ago, if we want to be exact, I had an in-person conference, and I went, okay, I did miss. Now that I'm back with people, I did miss it a little bit.
Yeah.
You know, there's another factor to this too that I actually witnessed. Happened to have had a conversation with a neighbor recently, older, they're probably in their 80s, pushing 90s, and they were religious about going 2 or 3 times a week to the fitness center. I mean, everything in the mornings, very early, about 7:30. Well, that was taken away last year because obviously things shut down. There wasn't that opportunity. The impact on the wife was that she's now in a wheelchair.
Oh.
Because she didn't have that weekly, very hard to recover from that. So aside from all the isolation factor was the inability to do the things that kept you well.
Kept you healthy. And those are exactly some of the things, this is where we get to start talking about programs a little bit. The Commission on Aging and the AAAs provide education and things like exercise class, over 60 and feeling fit and fit and fall proof as examples. But you're absolutely right. They were used to going and doing something, and not only was that a workout, it was also socialization. But then they stop because I can't go there, and they don't know how to find, for example, online exercises. There's a million of them out there, and they can do things at home. But that's the kind of agility, if you will, and flexibility that people needed to learn, and hopefully have learned with COVID, is how to shift and adjust to meet whatever the circumstances will allow us to do. But you have to be aware of what that is. I'm sure she didn't say, I'm going to stop exercising and I know that's going to put me in a wheelchair.
No.
It was an unexpected consequence.
So I'm wondering, as the two of you talk, did we really learn that much new during COVID, or was a lot of what we suspected reinforced? I mean, we'd seen some of this. We knew what the consequences for individuals, what those consequences were going to be. But when all of a sudden we've got this, we got this shutdown that's kind of enforced, now are we just kind of reaffirming what we thought or what we suspected?
I try to be polite about that and not say, I told you that. But yes, and it's been found everywhere, and for health and quality of life, the good old eat right, drink water, get plenty of sleep, stay active, that everybody knows, that we've all been told for all of our lives, became a little more apparent and relevant. So like I said before, I think COVID really just magnified or brought focus to a lot of things that we already knew, but we get complacent and we don't remember them or think about them or plan ahead for those eventualities.
So one of the things that we saw amplified, if you will, was I'm not going into a facility. I mean, that was just, there were the COVID issues, the coronavirus issues. I'm not going to go there, so now I'm going to be at home. Did we learn about being at home? Again, this is probably, we didn't learn much new. We just saw what we had, suspected. People at home, what were the challenges? We've talked a little bit about the isolation.
I've been talking a lot. You want to start with that one?
No, actually, I think we've been able to get a lot of information about all that as we're going along out, but it was a mixed bag. It truly was. I was working in a community, and yet I was connected with people in their home, and it was always, the grass was always greener. So if you were in a community, what we saw were people, wanting to leave because it looked better on the other side. Well, I can go and do what I want is what they thought they saw. I can be with family is what they thought they were seeing. Conversely, people that were maybe in a home environment alone or even with family, it got challenging because it was difficult to get resources to them. They were still restricted. So it was fascinating to watch this crossover of, it must be better in another place.
Brilliant.
The news actually, I won't say did a good job, did a lot of work on, I think, showing the heartbreaking parts of being in facilities that were locked down.
Oh, yeah.
People could not see their families. I know someone, and it's funny now, but her mother would drop her dirty laundry down off of her balcony, and her daughter would pick it up, and then they'd hoist it back up because her daughter couldn't come in the facility. And again, there's, and it's heart-wrenching to me when we first heard people passing.
Yeah.
And nobody was there. And I'm like, oh my gosh. I actually told my husband, if either of us has to be hospitalized, and we know we're going to die, I want you to get us out of there for
Sorry.
however long so that we can have those last few minutes, because no, that's not okay with me.
And you know, one of the other factors that came out of it, and I don't know how you correct it, it's just simply, you know, an observation. The mixed messaging and the communication piece of this was as hard on them as anything, because it changed day to day, sometimes hour to hour, and older people, well, probably a lot of people, just have problems with the unknown, with you know, change, and here they are in a situation that is looking dire, and really not knowing what to believe based on what they're hearing. It would be different based on what the media said from maybe what the community was telling you. And admittedly, everyone was just scrambling to come up with the right path and the right solution. And yet they really paid a price
Yes.
for
Yeah.
all
And
of
we
that
still do.
confusion.
Still do, because there's lack of trust. You know, now it's about boosters. Is it good, is it bad, which one do I need? And yeah, in my list of lessons learned, it is for all of us to understand that there is imperfection, because COVID was new. We knew a whole lot about viruses, we knew a whole lot about making vaccines, but there also was a whole lot that we didn't know. And so when people would say, oh, I can't trust it because it changed, we have to understand it changed because we're learning.
Yeah.
And it changed because the virus is changing, and it's not that people are right or wrong, they're giving the best advice they have at the time.
Yeah, my dad was a research scientist, so I grew up with, you know, the information we have changes. We learn, you know, we have a new paradigm, then we have the paradigm shift, and so we just keep, we never really know everything we think we do.
And I think
Want to.
Yeah, I think people forget that it's the practice of medicine, not the assurance
Yeah.
of medicine. And yet, we want to be assured
Yeah.
and comforted.
Yeah, well, I can appreciate that. So, was there a shift then from assisted living to home, you know, or independent living? And people, so what I heard you say is, well, some people looked at that and said, well, that's even better than what I've got. Was there a big shift? I mean, were people moving back and forth?
Yes.
What are we doing?
Yeah, so once the community was open, you know, during the time it was shut down, there wasn't anyone going anywhere. Even if families wanted to take them, they couldn't, they were restricted. So once there was that window where there was some movement, we saw it. And we saw those individuals who were living in an independent living environment, but they were socialized and provided services and everything they needed, suddenly say, I'm going to go buy a house. I'm going to go back to, you know, a home environment where I can control my world.
And those that were living in their homes, we're kind of stuck, like you said before, because of lack of services. We had such an issue with, first of all, if I'm at home, I don't want to have somebody I don't know coming into my home to provide services. I don't know where they've been.
Yeah.
And the care providers are, again, going home to home, knowing the same thing. I don't know what's been
Yeah.
in this person's home. And so that in itself took a while, actually many months, for people to get more comfortable and say, okay, I can go somewhere else in the house while somebody, you know, does some cleaning or something like that. But
And yet
then you also had the services, nutrition services, things like that, that fortunately we could provide. So our congregate meals basically had to close down overnight and become drive-through pickup and meal delivery.
Yeah.
And that was a huge shift for our nutrition program. Probably the biggest change that had to happen was with nutrition.
And yet two things were happening about at the same time. There weren't enough caregivers because people were choosing to get out of the business. They were
And
exhausted.
still are.
And still
Yes.
are. They were exhausted from it.
Oh, yeah.
The pay was never been great, and you know, so they looked at that factor too. So the home care services were struggling to provide what all of these people were looking for. At the same time, they were having to raise the prices.
Yeah.
The costs were going up
Yeah.
to accommodate that. So you have that dynamic of, yeah, it might have been a better place to be, but now where were you going to get those services from?
So, like, if this is the pivot, if we're close to getting this behind us, and again, I'd like to say that, I'm not sure I can. I don't have the expertise or the, the information to do that. But if we were pivoting about now, looking down the road, what do you see? Are we going to lose some of the assisted living or independent communities because, are we not going there now? Or you think, yeah, hang on, we'll be back? What do you think?
So I think that, first of all, I think everything is going to basically settle down. People will go back to making choices based on the same criteria they made them
Okay.
before. But I would say as it relates to the independent living, the assisted living memory cares, one of the driving forces now for moving into them are the costs. So I will hear people say, well, I'll hire a home care provider. Well, at $30 an hour times 24 hours in a day, it's not sustainable. The cost.
Not for very long.
No.
I
Oh
am
my
so
gosh.
happy to say that we finally are getting consumer-directed services. So for transportation, chore, homemaker, and respite, it's a game changer. It really is.
Oh, very
And
good.
of course, the challenges always came because you have federal and state monies, and you can't just give somebody money, they have to verify it, but I let other people deal with that stuff. What we've done with consumer direction and are just now starting is saying, you know what? You as the individual probably know somebody that you trust, that you like, that knows you, knows your situation, that lives near you, that can provide transportation, that can come in and clean your house once a week, can provide respite for your caregivers. And you get to set the price. You get to basically say, hey, you know what? You're my friend from church, and would it be okay if I paid you X dollars per hour? They provide the service, they get paid, you get a lump sum basically for a period of time. And, you do have to manage it. When it's gone, but that does allow people, especially in rural areas where there aren't service providers, it allows them to find services that just weren't even an option for them. So we're very, very, very excited about getting that started.
Yeah, that's great.
Yeah. Is that something that we families can pick up on and go, oh, this is a little bit different way to do this? Are there ways that we can interact with, programs like that? And by the way, we'll want to know before we're done how to access that or access
Absolutely,
information.
absolutely.
But as a family, we're going, hey, that's a great idea. Can that influence the way we think about helping mom and providing services? I mean, I think some families get it, and they're going to interact with home health or home care, PCS, with neighbors and friends and the church community. Some families don't get that, or, it's just a struggle for them. Do you see us moving in that direction?
Yes.
Okay.
But the key to all of this is education.
Yes.
People don't know what they don't know.
Right.
And they know either I deal with mom and dad at home, or I put them in a home, the home, right?
Well, and I hate, by the way, I
Yes.
hate that phrase.
Yes, we're trying to get rid of that phrase.
Put them in a home, because that, to me, there's a couple things. One, they need to decide. You don't put anybody anywhere. And two, it seems so final. I put them in a home, I'm done. That's what it sounds like to me when somebody
Putting
says.
them away, it's kind of the same.
Yeah, they had to
Yeah.
put their dad in a home.
Yeah, exactly.
I don't like that. And by the way, when I hear people in that industry use that terminology, it just rankles me really bad.
I kind of do the same thing, but with education, and that's kind of our job, is to get that message out there. And a couple of things from my perspective. One is, that's what technically it's called the Aging and Disability Resource Center. To the public, it's called No Wrong Door.
Oh.
That means that you can contact any partner within No Wrong Door. They will do intakes and give you the reliable information on what your next steps can do. And a lot of that means not repeating the same information. I didn't have to go to 4 different agencies and fill out the same information over and over again. So the starting point for those is always going to be the AAA, the Area Agency on Aging. It could be the SILC, the State Independent Living Councils, and a variety of others, including, health and welfare, Medicaid, Medicare, the VA. But that's what we're trying to build with No Wrong Door, is saying, my mom just had a stroke, and I thought she was going to be, okay for another 10, 15, 20 years, but now all of a sudden we need long-term services, and I have no clue what that means.
Yeah.
So by doing that, we can accommodate those needs, get them in the right direction with many of the things that you've already been discussing.
Yeah, and Kathy, do you see that industry growing on the private side as well? When the family can come to you and say, help?
Absolutely, yeah. It is a wonderful service that our company provides, others do as well, where they don't know what they don't know, and we can facilitate, we can advocate for them. We basically just can handhold them through the process. We can help ask the questions they don't know to ask. We can be that buffer between the whole process so that they don't have to basically juggle with all the phone calls and the information that's needed. So yes, we see that shift. But one of the thoughts I had when you were commenting about the wonderful services, and I know since I've been in the industry, all of the senior care providers struggle with this. And that is, there is no one easy repository where all of those resources exist, where they simply can go and get that list and know where to go and what to do.
ADRC.
But
It's not there yet.
That's an acronym that if you went down the street and said something,
No longer.
they're not going to know it.
Exactly.
And that's where places like Learn have been developed for that very reason, so that there is a repository, so there's some place, for people to go. Now, granted, we have the challenge of getting the word out about Learn, but that is what it is supposed to do, is that they can literally just go and, wherever they happen to look, whether it's online or YouTube, they can get the information.
Exactly.
But it is still a challenge for all of us.
It's a big job, and I think what I hope is actually going to happen is the true partnership between government and private, for-profit, not-for-profit. It shouldn't matter. It can't matter because we need all of those pieces. We also need the medical and healthcare industry talking to us.
Hold that thought, because we're going to get there in just a minute.
I'll hold it.
Yes, no, you're right on. What we see when they come to us, and I mentioned this in the last session, I had a couple come in and she was terrified. He has, what I think is correct, a tentative diagnosis of Alzheimer's. And she knew nothing. And perhaps she hasn't looked, I don't know, but I do this all the time. If you went to the interweb and you put in there estate planning, you're going to get, and it tells you this too, I just love it, 5.75 million hits in 3.3, 5 seconds. And you're sitting there going, if you don't know about estate planning, how can you even, walk through that? And so that information is it's out there, I'm sure. And so I don't know, she needs a place to start, right? She really does need a place to start. One, she's got to get past the being terrified. And that only comes one way, and that's information.
Good information.
And good, accurate, and, you know, tapered to her needs, not, you know, 7.5 million different articles and, you know,
And there's a difference between estate planning for somebody who is middle income Idaho with a chronic condition coming up versus somebody who just needs to manage their $9.8 million
yep.
homes and things. So estate, like you said, estate planning is again a very generic term.
Yeah, and so they go, but if they put in Alzheimer's, just completely inundated, right? It's the fire hose open and they're trying to drink from it and they have no idea how to deal with that. So what I'm wondering is, did we learn anything? It sounds like we're making some progress, at least in Idaho, of what information needs, and I like the I like the innovations as far as delivering services as well. But did we learn anything over the last, 20 months about how to deliver information? Have we, is that something good that's come out of this yet? Still working on it.
I think it's the yes and the no, right?
Yeah, and I actually think there's been some innovation that has come out of it. I don't think 18 months ago, a lot of people had heard the word Zoom, but they really didn't understand the benefit. Today, things that we used to do in person, choosing to do in a remote way because it's more convenient, it can be recorded, you can see it anytime you want to. So there is a much bigger push, I think, toward technology as that solution for finding out what you need, where people before might have just gone door to door, word of mouth, friend to friend, and now they're being forced into the technology world. That's
Well, we learned, I think, we did in our practice and personally, that old people can actually do the computer.
Yes.
They can learn to do this, and it's opened up a world for them. Carly over there, her nephew talks into a portal to Grandma and Grandpa all over the world. Just completely random. When he decides to do it, he goes, "Hey, Grandma," and he can do it. And is he 3.5, Carly?
Not quite 3.
Not quite 3, and he can do it. So I think we've picked up some things there.
I think that push is 20 years too late.
Oh, I know.
I was doing that 20 years ago and going, why don't people, so that's one of those great silver linings from COVID, if you can find them, is it forced a
That's
culture
to do it.
change
Yes, it did.
to accept technology. However, and remember, I'm a tech goddess, so that's, this is not, hard for me to say, but we do still absolutely have a technology divide. Part of that is because high-speed internet is not available in some of the rural areas of Idaho, and unfortunately, some of it is based on the inequities we see because of cultural differences. We have a lot of Hispanic communities in Idaho that do not have access or a lot of access to high-speed internet. Some of our native tribes are having issues getting access to internet, and so while they may want to be able to communicate that way, we still have to go back to, and we don't even say the word anymore, newspaper. Oh my gosh, sorry newspaper industry, but in some of our rural towns,
I have
the newspaper is
stories
still
how we
a way
can't
to
get
do
a
it.
newspaper but once a week, and we get 7 because they can't get people to deliver it. Oh my gosh,
Yeah,
it's
it's
a long
a
story.
challenge, but technology can be an answer, but only if we make it equitable and accessible
Yeah.
for everybody, including the education on how to use it, because not everybody does know how to use it,
Yeah.
and the infrastructure to get it. to
Well, it took us forever to be able to do telehealth,
Mhm.
right? I mean, not just the technology, but also the law
Yes.
and how the medical profession governed itself.
And insurance coverage.
And insurance. They just weren't allowed to do it, and we were forced, right? We were then forced, and we found out is, it's okay.
Yes.
We haven't killed anybody, because we couldn't touch them. We couldn't see them and provide a lot. So
There's another aspect to it I've often thought being in this industry. When you're in your, in your middle 40s and life is going crazy and you're busy, the last thing you're thinking about is what is going to happen when. So I find that people that all of a sudden are confronted with a parent or whatever the circumstance, they've put their head in the sand for so long that they go into panic mode because they don't know how to navigate it. Well, as we as providers recognize, it's very complicated. So I see a need to basically promote showing younger people the information, getting them, encouraged to look at it, to educate themselves, to know what they need to know going into it. So they're not just suddenly so caught by surprise when it happens to them.
well, it's interesting you say that because we've got about 7 minutes left here, 8 minutes, and I kind of wanted to shift into, well, what should we be doing, right? There's always going to be some issue. And are there ways that we can prepare ourselves? Have we learned something over this that we can go, all right, here's some things I've got to figure out for me, and maybe for me, and then for a loved one. But do you have some suggestions? And I like the idea that, man, they should come face to face with it sooner. And because there's a couple things. One, there's the legal planning, and that's what we do, and we get frustrated a lot because they wait till the very last moment. But you know what, there's a whole social, there's a mental, there's an emotional component to all of that, and as a society we've decided we're not going to deal with that, I think.
We need to stop that. And I hope we've learned that, and that's why the concept of successful aging, you don't start aging at 65.
What?
You start aging at birth.
Are you telling me I've already been aging? 'Cause,
Yes.
I got a couple of years.
We're all aging,
Okay.
and that's good, because if we're not aging, then that's bad news. But what that means is, and I think we've both been saying, is don't bury your head in the sand. Do it early. First of all, it's really hard to make these decisions when you have somebody who is sick and or dying. That's not the time to try to
Crisis,
think about it.
urgent,
Yes.
overwhelmed. Yeah.
Exactly, it's too much. So start now, get some education, take some free, I think what we do is free education on all of these topics, and ask yourself those questions. How do I age in place? How do I age in a facility? My mom is 87, and we need to tour some facilities, although she's never said she doesn't want to do that. She's also said she will never move in with her children, which means she's going to be aging in her condo, right? Okay, so what kind of services can we get? She lives on the first floor because she used to live on the second floor, and that's not going to work when you're older. So all of those little things can start to come into mind when you're calm and it's not a crisis situation, and deal with, like you mentioned, the health, medical, the psychological, social, all of those different parts of aging, and make a plan. When you have a plan, you generally don't have a crisis because you know how to be flexible and move into whatever that may be, and backups. You've got to have that plan A, B, C, and D, because plan A sometimes doesn't work.
And I think about the work that we do at Learn, and we kind of joke that it is a drip, drip, drip. It isn't like there's one path to get information out, or we would have already found that. And so I guess I would look at all of us as individuals within the community, taking the responsibility of talking about it, sharing what you know, sharing with people that are in need of it, or even those who don't know they need it yet. So if you happen to have a community group that you're involved with, or a church group, or your kids', sports affiliations, whatever it is, start the conversation, you know. Be brave enough to put it out there and say, I'm having this struggle, I want to share it with you guys, because you might need it too. But I think we keep it so insulated, so personal, that they're not getting the opportunity to benefit from the information.
So I'm gonna get a car with one of those big speakers.
Please,
And
we
drive-
need that in our rural areas, that's kind of,
Well, but hang on, here's the messaging that I would give. Hey, you over there in the garden, you're gonna die. And then, well, but we do. We
Yes.
deny that, we avoid it, we
The
push
D word
it.
is awful.
Oh, yeah, and it's strong.
And we're
Yes.
all terminal. I mean,
It's, yeah, and then
I-
that's what
I
we have
know.
to do, is we have to kind of lighten that up when it's appropriate, and say, it is what it is. We're all, we're all born, we're all gonna die.
But Mark, I'm gonna count on that.
I can come through your neighborhood. How's that white again? What is he doing down there? I know that historically, and my family is an agricultural background, they knew that, right? That's the cycle, and they're all comfortable with, they were anyway. We had families that would work to help take care of mom or dad, but we knew what was going on. And then we're a very transient society. We move, we're different places. We're in Florida, and mom's here, or vice versa, and that makes it really, I think that makes it a challenge. I don't know how to break through that. We got a minute and a little bit. Give me a takeaway. If you could get somebody to take something away from this discussion, just even one thing, what would it be?
Don't wait. Start early. The sooner you start the process on any of those topics, whether it's estate planning or how you're going to care for, give thought to it. Don't wait to the last minute.
Even if you're only 45.
Yes. Stay healthy, stay informed, stay safe, and stay at home, whatever home means for you. And find those resources. And we know that that's challenging, but you now know, the two of us, I'm going to give you the website.
Yes.
It's easy, www.aging.idaho.gov. We'll get you to our site with all of
very
the
good.
services and resources to
Do
be
that again.
successful. www.aging.idaho.gov.
Very good. Very good.
Yep. And we've got www.learnidaho.org. So once again, www.learnidaho.org.
I think, like I said, the gal that was in last week, that is so easy to get terrified or overwhelmed, and there's only one way to fight it that I know of, and that's to start learning. And so I can follow
And take
up on
small
that.
steps.
Yeah.
Don't
Yeah.
try to do it all at once or you will be overwhelmed.
Yep.
Do one thing at a time.
Very good. Thank you, both of
It's been
you.
a pleasure.
This
Thank you.
was awesome. Appreciate your expertise and your experience, and looking forward to having you next year as we do the third annual.
Yes.
All right, we're going to take a break, everybody. So go take the bio break. Maybe stretch the legs for a minute, and we'll see you in just a bit.
Okay, I've been wanting to
Yes.
And I still say.
Oh, you're coming back? All right, very good. Oh, that's right, you are. Okay, you want my elbow?
What would you like?
Can you get past those two lights, okay?
I might, but you know what, the answer is I don't know.
I know your face from
My mom says that.
It's really the most.
Light overhang
So can
there.
we see her? I'm like, well, I'll know when I do.
You're
And
very
then
welcome.
you got it.
All right.
You
Thanks
have
so
your-
much.
you're
It
welcome.
was
Thank
a
you.
pleasure. It was fun. We didn't have enough time.
No, you know what, we should just do one for a day that's just.
I'm learning what I do, which is, you know, on the year, just we need to continue messaging and all that. So I like to talk. And
Your
you're
face
On that picture, right?
That's the important.
Sarah from yesterday.
Yes, thank you.
This is
The
our.
only thing I will kind of say that
Oh, very good.
I can't see your face.
That's why it's like, oh,
Say my
sick.
name or
Yeah,
something.
got it.
Well, that's why sometimes I sit there and I don't want to cut off Kathy if she's supposed to be answering.
Probably good food.
I can't do it anymore.
Good to see you. You as well, finally.
Yes, like, stuff's right over here.
My wife got me this thing because I won't have much.
It's just really quick, like
I'm on in about 2 minutes.
Perfect.
Between the breaks, I take.
All right.
Lovely.
I'm a subscriber to Learn, so I already know
Thank you.
that that's the easy part, and I know the power we can have if we all do this together, and so that's what my people told me, go to a meeting, and you've got 32 different agencies all trying to do the same thing that's separate. Yeah.
Come and sit down.
Get the hot seat.
Yes,
I'm
ma'am.
Melissa Rabbit. We haven't, I don't know that we've actually considered that.
Yeah. Yes, I have seen you, I know your name, I've been to the caregiver conference and know that you've been involved there, but we've not taken the time to.
Haven't done this yet.
So we'll get to know each other a little bit more here.
Oh, I know we would. I want to do more.
But here's what I'm saying. Why don't you finish sponsorship for half of it? Okay. You might not do whole, but,
Yeah.
you know.
Yes, indeed, that'd be great.
Do you have your new card? Bye, Kathy. See ya.
Whoa, I was just about on that. Is it okay if we bring water over to the
That would be
table?
Yes, totally
absolutely-
fine.
Hi. Well, it's been so long.
It has actually.
Oh, it's
Good
good
to
to
get
get
a
a hug.
I know, it's great, isn't it? Boosting and.
Is that Bill?
There's, what did they say about hugs? Like, how many do you need a day for self-sanity?
Hey,
Like 20.
Like 20. Now we need like 40 for recovery mode.
for like still now?
To make up for the ones that we didn't have.
Make up for everything we've missed.
Didn't they, don't they have a,
Okay.
like a
That's
time?
okay.
We have so many minutes or something.
Of the hug?
Yeah, that you're associated with, so,
Because they're still on.
and
Wait, what?
Bill can still hear everyone.
How can Bill still hear everyone?
Oh.
There's no way Bill should be able to hear everyone. What is,
Yeah, I don't know.
now, what
we'll
about,
be quiet and then get going.
what about now? Can you hear me now, Bill?
Or can they see us?
They can't see you.
Well, good, we'll just
Well,
blame it,
Okay.
we'll blame it all on Dee.
Is it getting better? I'm just gonna.
And we're back. Oh, thank you for hanging in there. We really had some good discussion this morning. Yesterday we had some really great discussion. This is the second annual No Place Like Home Conference or Symposium. And the concept is that a lot of people that would like to, in their minds, age in place, and what we find is they're not sure what that means. So we would like to help educate what that means, and then we would like to make sure that that's a good thing for them, because sometimes aging in the family home might not be the best thing for them. So we're going to talk, this one, our session here is going to be a little bit more specific than that, but we have some great folks with us. Reminder that thank you to our Garden Plaza at Valley View for sponsoring us. They've given us a room in here. They bring us food. They bring us water. They won't let us out of the room, which is why they bring, no, that's not true. And then Home Instead, thank you. And Blue Cross of Idaho True Blue Special Needs Plan, thank you as well. So today we're really trying to handle an ounce of prevention is worth a pound of cure. That's probably not the right ratio.
It's probably, a ton.
But yeah, I was going to say a term that maybe we shouldn't, but yeah, more than a pound. And so joining us in this one is immediately to my right is Dee Childers, and Dee and I go back a little bit.
A little bit. We don't have to get into years.
No, I've decided not to do that. And Dee comes to us from Life Changes Elder Care Consulting. Before that, you were in the
HR.
HR.
Everybody's favorite department.
Yes. And all I'm telling you is if she could negotiate HR for companies, big and or little, doesn't matter. She can negotiate through helping families figure out what the next step is. And it would be so nice if we didn't have to worry about that next step, because we'd already figured that out clear back there, but that doesn't always happen, so sometimes we need that next step. And one thing I need to mention, because you are a certified elder mediator, and people don't realize, some families get this really quick, that not all the kids are on the same page. Can I just say that?
You could say that.
Is that accurate?
It's a very accurate statement.
Well, and I've noticed they all grieve in their own way, and they all care about mom in, their own way. They view the world in their own way, and I just explained the whole COVID thing, didn't I? Right?
A bit of that, for sure.
Diversity.
Yeah,
We
so
celebrate it.
So families can sometimes have struggles, and Dee is wonderful at working with the families to kind of find a path forward, and I think that's wonderful. Thank you.
Thank you.
And Melissa Radloff, who is the director of everything. Okay, just 3 projects.
There's a few lists.
From Janice, tell us a little bit about Janice.
So Janice is a local nonprofit that is an umbrella for about 20 different projects, different programs under Janice.
So
And
should we mention the ones that you're not over, or just the ones that you're
just
over?
the ones that I'm over,
Okay.
because the ones I'm over are all focused on serving seniors, older adults.
Oh, very good.
Mhm.
Very
And
good.
we have a new website that I'm really excited about, and it's called Aging Strong. And so it kind of helps me think about like a new way of aging,
Got it.
because we're doing it strong.
So is that the typical www.agingstrong.org?
Exactly. Org.
Org? Okay, very good. Thank you. And works with the Legacy Core program, which is wonderful, by the way. and you also work with the powerful tools for caregivers, which is wonderful because I just know the families that I see that don't understand the incredible effort it takes to be a caregiver and the impact it has on them personally, and as well as other relationships. And it just, so maybe when I get my little card with the speaker on top, I can go around and say, hey, you there, not only are you gonna die, just trying to get their attention, right?
Let's age strong.
Yeah, let's age strong while we're doing it. Anyhow, all right. So what we'd like to cover today, and we talked a little bit before we came on camera, was identifying or understanding, a support system. I think that we were just talking in the last session that ignorance, the not knowing is so strong, and it just is so easy to get overwhelmed and to panic and just be terrified of the situation. But I think the second part of that is thinking that you're all alone, that you got to do this by yourself. And so I thought that's maybe where we'd start, and knowing the two of you, we'll just see where it goes.
We kind of talked about just talking.
Well, this will be great. You'll enjoy this, I can tell you that. But it will be very informational as well. So let's start with that, whether they, I don't know that they acknowledge to themselves, but I've seen it where they think or feel that they're in this all by themselves. Dad's got Alzheimer's, and now I gotta deal with this, whether that's a spouse or a child. Tell us why that maybe isn't the best thinking.
Well, I kind of have been a living example of that. That was my approach for a few years, was sticking my head in the sand and leaving every gathering with my mom and dad and communicating with my sisters, we need to do something here. I see changes. We need to do something. And then we stick our head back in the sand until the crisis came. And crisis is not the time you want to be dealing with this. I can tell you firsthand, it is overwhelming and not helpful to you or to your loved ones. What about you?
Well, I love this opportunity to talk about it because I love going back to what Rosalind Carter quoted, in that there's 4 types of people in the world. Those who are caregivers, those who are going to be caregivers, those who need care, and those who are going to need care. And it's just inevitable that we're all in one of these situations, and it's not a college course or a high school home ec course, or we're not prepared for this. And so it's something that we find ourselves in, where we have to ask for that help, because it's not just ingrained in our education system and our normal family models, and we can't do it alone. So I love that we can just talk more about it and make it a more normalized part of our world.
It is. Well, and if you think about it, we used to grow up watching our elders take care of their parents. And so we had real-time training and experience about what that looked like.
Anyway.
We did have a model, and now we live so far apart from each other, and we just don't take care of each other in our culture today the way we used to. So we're lacking all of those skills. Plus, we don't see so many of our loved ones often enough to really pick up on what's going on until it's real obvious. So we need to become good at picking up those clues, and even better, which is what we're going to talk about, is kind of knowing in advance, well, what do you do when you figure out help is needed? Right?
I would add to that not only are our family structures very different than they used to be when we saw family taking care of family in the household, our medical system has also changed through the years. So no longer is it normal to stay in the hospital after a surgery or a procedure. It's now outpatient and you're going home, and caring for people at home more and differently. So, right, so it does call for different types of communication.
So would the two of you knock it off, because this is scary. This just
Sorry.
this just seems kind of scary. Well, and I think that's why you see people that are just, I don't even know where to start. So if I have someone who is just, I mean, you can tell, some of them will acknowledge, I'm in this all by myself, or I know they're not necessarily, but
Right.
that's what they say.
Yes.
And then there's others you can see and go, oh, she thinks that she's got to do this all by herself. Where do you start? How do you talk to that person?
Well, one of the first things, being the firstborn of two firstborn parents, is that those traits of taking it on solo and independent resonate deeply for us, as well as I see Carly raising her hand over there. So it's a natural go-to for some of us. Oh, we have to be in charge, we have to fix all of this. And the truth of the matter is, you are not going to be as successful as you can if you take that approach. And we'll provide you a copy of the handout for the website if you'd like, but it's a way to start looking at your support system with concentric circles getting bigger and bigger, and having you literally do the exercise of figuring out, all right, who's in the center for this caregiving task, and it's probably you listening to this right now.
Although you could be helping someone.
You could be helping
Yeah.
someone. And the next circle out is close friends and family that would step up and be there for you. So to start writing down names, you don't need to be assigning anything right now, but just write down names of people that are close to you, close to the senior, the situation, and who are those folks?
Now, when you say close, do you mean geographically here that are close, or do you mean emotionally that are close? What do you mean by that?
And that's an excellent question, because in some ways we kind of need to divide that between close emotional connection, because they're a great support system in one direction, but they can't do hands-on as well. So then there's the people that are close to you that are available physically to do hands-on kinds of things, when you get to the point of having a list of things that you want to do. And then beyond that, what's the next circle out? What's the extended system look like, both geographically and connection to the family system and to the senior?
So you could be talking about the very, so if I'm in the middle, then that next group for me would be siblings, my spouse, grandkids, that type of
Could
thing.
be.
That next group out there, though, that could be neighbors, it could be a church community that, that kind of keep an eye on each other. What else can we think of in that? Just to give us an idea of how to think through this.
Right. I think neighbors, just friends that are in town, close relationships, people will have folks that they went through the service together. That's a connection, but maybe they're not immediately close by, but they're great emotional support. It could be distant relatives, anybody that has a connection to the person that we're talking about that you think might be interested in participating in the process. But just to write down names. You don't do problem solving about, well, if this, then this, or they can't. Just list names. I think you'll be very surprised about how many you come up with.
And with those lists, remembering that these are not just people who are close to you, but also to the person that you're caring for. So if it's your father, then right, his military buddies, his church buddies, his folks, and reaching out to, including their names in this list too, because they probably want to be a part of it and don't know what to do.
Exactly.
Well, I think we established that from the top. A lot of people that don't know what to do.
Right.
Yeah.
And that's usually because we don't tell them. So that's going to be our next step. But I want to go two
Got
more
it.
circles out.
Very
And
good.
the next circle out is really, who are the professionals? Because we do sometimes forget that the professionals in our world are there to help us as well. I love my chart with one of the medical systems in town. I can't tell you how much more I get done because I have direct communication to any provider in that system that my person sees. And so all of the medical people that are out there that are part of that team are part of your team and are a resource to you. And then, do you want to talk about the next one?
The community support, no, not really. I'm thinking, I'm not exactly sure what you're talking
So
about.
I'm thinking
what you're
like,
fitting
well,
in there.
first of all, the powerful tools for caregiving, I have to tell you, that is an excellent
Yeah.
training program. And when I first found myself in this journey, which was 12 years ago now, and I didn't know anything either, and I took powerful tools for caregiving, and it was so foundational in helping me understand the role and some of the other things that we're going to talk about today. But there are support groups out there for people who are in the caregiving role, and some of them are disease related, and it doesn't really matter. They're support groups, and there are some that are not disease related, that are more general caregiver support groups. And to take advantage of that, and one of the things that's kind of been an upside of COVID, if there are any, is that we've all gotten a lot more comfortable with electronic communication. So
Yes.
Zoom meetings, Hangouts, whatever
Boy,
platform they're using.
that sounds familiar. We might be doing that right now.
Yeah, exactly to the point. And you can get support. So I do co-facilitate the early stage Alzheimer's support group, and that's the one with the participants being both the person with the diagnosis and their care partner. And we weren't quite sure how that was going to work out on Zoom, but you know what? It worked out fabulous, and everybody felt strongly that they got the information and the support and their needs met. So keep that in mind, that it doesn't have to be in person right now. Virtual is the way our world is working primarily.
Can I ask a question on behalf of those that are listening and going, I need to ask a question? That's what an advocate does.
Yeah, absolutely.
The community resources. The question that I have there is, and I know Melissa knows a ton of these, where do we find information about this, right? You know, if because we're trying to map this a little bit, right? We're mapping this, a lot of community support. How do we find out?
Thanks, Steve, for covering for me on that community support. I know where you're going with this here now. I have a better idea. But right, so I wanted just added to the community support spectrum. I would really include faith communities are a huge go-to, and even if you're regularly go to a church or I am finding that every website everyone has different groups within their faith communities that maybe you can network in deeper into those communities that you're already involved with, and maybe it's through veterans group, the VFW. Oh my gosh, they have so many opportunities to connect, and the vet center. There's so many out there. But right, how do you navigate? How do you find the ones that are connected to that are going to work for you? And so caregiving through the lifespan, we're not just talking about people who are caring for someone who is aging, but also adult or younger children with different disabilities or special needs, and the myriad of caregiving that we see in today's world. But I always say first go-to is the area agencies on aging. All over the United States, no matter where you live, there's an area agency on aging. That is a good first hop-off point. And I wanted to, one other thing about the community resources. I know in previous presentations, we've all been talking about, wow, the internet and virtual connections are actually possible for a wide range of age groups, and it might look different. We've been having a lot of meetings, Zoom meetings, where a lot of the participants are on the phone. how they can get on. But our communities in many ways are getting larger. So even if there's a support group that you don't quite connect with, there are even more options now available through Zoom or through conference calls or all the different ways people are setting it up.
Awesome. Is there one more? Did we get to 4? You said there's 5 different circles
Yeah,
on this?
I'm good with the circles.
Okay, because I was just like, okay, so what's after that? What do you know?
We were at the middle of it, so
Yeah.
from there, we've got
Okay.
4 others.
Well, I would hope that the first thing that happens when somebody goes through that is a little hope.
Yes.
All of a sudden they're going, wait a minute, I don't have to do this by myself. Now, the oldest, is the caregiving child, and they take care of the rest of us, and that's great.
What's your birth order?
I'm number 2 out of 7.
Oh, so you kind of are too.
Yeah, so my brother and I, anyhow, it's a longer story, but some are still a little bit stubborn, right? I mean, they go, yeah, sure, but they're not going to help me. What's the next step? After you've listed this, and now we've got something about, if not a map, I mean, in a true sense of a map, we've kind of got a list of folks. What's the next step?
I think that the next step is, well, I think along with that, or something that needs to be brought up at this part of the conversation, is that the prioritizing and recognizing and honoring that self-care is critical in caregiving and in supporting other people and aging in place. And so putting yourself as, the next step is, okay, how can I ask for help and where do I need help? And what are the things that I need, as well as what are the things that the person I'm caring for needs? So that because if you get burnt out, caregiver burnout is a real thing. It happens. And
it can flatten you flat.
and it's not going to flatten you in a planned way. You can't plan that. So we can't stress enough to make sure that you are making time for yourself and your own personal needs, because the next step is then trying to come up with your list of where can people plug in, because then you kind of turn into command central or post central, and as the youngest in the family, it's funny how the family dynamics come into, like, the oldest is always going to be in charge and in control, but yeah, so where can I need help? Where do I need help? Where can I accept help?
Hold that thought, because that's like 20 minutes of conversation there, but we'll talk about that. But okay, so we start, is that what we do next? Is we starting to measure up, okay, I could sure use some help here, and here. And then you divide that out. I've got professionals here to help with this. But I got some friends, maybe an army buddy that could go fishing or something.
Well, I think there's kind of 2 parts here, because we're not in this alone, but we might be the caregivers, but then there are the care recipients, and they have to buy into this at some level. So that is a really key piece of this too. So we can make all the list we want and get involved with all the support groups that we want, but if Dad is still saying, I don't need help, I don't want you in the house, I don't want you doing this, I don't want you doing that.
They never do that.
I know, they never do that, but every single day. And denial is not just a river in Egypt. It's a way of living. And what is interesting to me that I see in my business is that seems to be a bit more true for the generation prior to my parents, but not quite as much my generation. I'm in the boomer generation. Boomers were a little more aware that we need to plan if we want to continue to stay in charge like we always have. We like to change things. So I see a little more planfulness, but we're still dealing with a lot of people who independence is their core value.
Oh, yeah.
And that's really a big piece about what we're talking about here is people's values. And if independence and not being a burden, I mean, how many times have we heard that with people that come into our office? I don't want to be a burden. And
Yeah.
yet, they get so hung up on that. It's like, well, actually, it's even more unhelpful that you
Yeah.
won't let me help
They're
you right
even
now.
more of a burden.
Right,
Yeah.
because now I'm cleaning up when you have to go to the hospital emergency. So we do have to, one of the things I think is so important is to start engaging in this conversation with our people in our world earlier than crisis moments. So we know crisis is going to happen and you're going to have to do what you have to do to get through the crisis. But then when the crisis is gone, let's take a step back and look at the bigger picture. So your list includes things that, you know, your folks, your loved ones are willing to look at perhaps some help with. And you gotta start baby, because sometimes that might mean just bringing in a meal or two, right?
Well, we probably all have, if you've been involved in a church group in your life, you've probably all did a meal for somebody that lost a husband or something like that. But then you go, no, you're not going to bring a meal to my house, which is hypocritical, by the way. But that's how we are. We will give all the help that we can, but oh no, I don't need your help.
I think one thing that I see so much in our work, because the Legacy Corps program provides volunteer-powered respite to people. And what I see in our volunteers, and I think it's a good reflection on everyone, is that giving is a gift, right? So if we can help people understand that by asking for help, you're actually not a burden to them, but you're gifting them the opportunity to be involved and feel needed and feel valued. To kind of shift that perspective is one angle to try to go with, because I see it all the time, and I know we all want to feel valued and needed, and so it's giving someone that opportunity when you ask them for help. Hard to wrap your head around for many of us, but it is true.
It is, I've only seen it a lot.
A lot. Well, and the other part of that is then asking permission to be able to help. So that's one of the places that I see things go awry very quickly, is when we decide that we're just going to come in like the cavalry and save the day, and we're not welcomed,
We're going to be
not
the hero.
appreciated. Yes,
We're the hero.
and it doesn't set up a helpful dynamic for moving forward. So recognizing that help's needed and then asking permission to be able to do help in baby steps is really key to success.
So I see that happening a couple different ways, but maybe the first one is if I'm the caregiver and I've got my map put together pretty well, I've got my network here laid out pretty well, and then I have absolutely no idea what to do with that, would be a good time for me to ask for some help, right?
Right.
Is this really, I mean, we're not even talking about Dad letting us help, we're just, all right, I need some help with this, I got this, what do I do with it?
Right.
And so what do I do with it?
Well, one of the things Melissa and I were chatting about before is usually we're in the thick of it, we don't remember what those things are. So what we recommend is that as you go through your day and you're trying to multitask and get 12 things done at one time, and there's one more, go write it on a list. So you start a caregiving needs list. And you know, on your counter, on your refrigerator, wherever it is, but whenever you think, oh yeah, it'd be great if somebody could order groceries for us. Oh yeah, it'd be great if somebody could go pick up shoes or do some errands, or take Mom out for her hair and lunch one day.
Maybe that list can also be part of the sticky notes that you keep by your bed, because that's the thing that's keeping you up at night, or you wake up and it's twirling in your mind, and just like add it to this list, just get that list going.
Right.
So my my thinking is, knowing the people that I know, don't tell them that these are things you're gonna ask people to do. Maybe just keep track of the things you do, right?
Absolutely.
Because that may be hard for them to translate. Oh, I gotta go get the groceries. Well, they didn't think of it in terms of, man, wouldn't it be nice if somebody would go get the groceries?
Excellent point.
They thought of it in terms of, that's one more thing I gotta do.
Right, exactly. I like that. Not
So-
only what you're doing, but what you can't get done.
Oh, yeah, or yeah, this sure needs to be done. Oh, I gotta get the car washed. Oh, I got, all these
Yeah.
things. And so it seems to me that just making a list would be a good place to start.
Exactly.
So then we would have, here's a group that could be a network for mom or dad and one for me, or, we mix this together. Here's all the things that we do or that need to be done. All right, so I got this far. Now what do I do?
Well, prioritizing the list is really a good idea.
Okay.
What's at the top of the list, and what are some of the things that you feel particularly strongly about that must be led or done by you?
This is where it gets into delegation. This is where it gets into
Yeah.
the skill and craft of delegation.
Yes.
Of, are the outcomes of these particular tasks very important? How important are they to you? If mowing the lawn is one of those things that you can't get to, is really bothering you, needs to be done, and you're willing to give it up, does it matter if someone's mowing the lawn in a circle or horizontal, or are you going to be really attached to specifics about this, or are you going to be able to let it go? That would be a great one to delegate if you're not attached to exactly how it's done.
So I like to think of it, what needs to get done? When does it need to be done by, if there is a deadline? And, maybe one of your loved ones has an issue with never do it in circles, so in that case you might do how. But you want to find a way to empower the people that are helping you to be able to do things perhaps a little bit their way. So you give them what are the outside boundaries of this. So what's the desired result? And if they know what the outcome needs to look like, and we let them know, here's where I want you to check in with me, or you're good, just go do it. One of our families the other day, she was complaining that the caregivers were spending too much money on her grocery list. So I kind of took it to be that she wanted the store brand version, she did not want the top shelf version of it.
And or the other way around.
Yes, and or the other way around, exactly. So the clarity that we got from her in this conversation that we had with her is, okay, caregivers, you don't shop the way you want to shop, you shop the way our client wants you to shop, and she wants store brand, best deal, and that's what we're gonna do. And it's a small little thing that creates a lot of peace.
And adding, adding photos when it's like, this is the brand of Rice Krispie or whatever it is that I like, add the picture to that list that's going out with the caregivers. So as much direction as possible.
Right. So an example of that, you might come up with a food list that has brands, but you don't know how to type it up or to make an Excel spreadsheet. Well, who on your list is good with Excel?
Oh, very good.
So there's an example of being able to give somebody an opportunity to help you and really get something off your plate. And now you have a shopping template that you just check off, but you needed help to make that work well.
So part of this, I would guess, is what are the things, until I know better, I have to do? Can I get it down to, I need to help mom up in the morning, somebody needs to be there, and will she let me do that, or, whatever. So that would be maybe if we had another map with concentric circles, would be in the middle of stuff that I have to do it. I'm sorry, I've tried, but I have to do it. And then your priority after that. I love the idea of the clarity. Now, you probably get there from your HR background, that if you're bringing somebody in and you're training them, attorneys are horrible. Here's the case, go get it done. That's how I learned.
Right.
phoned it in, and, well, that didn't work. Well, yeah, because you did it wrong. And so the clarity of, well, let's get it done this way. And it seems to me that if you can do that, then the grandson or daughter can mow the lawn and sweep up afterwards and do the edging, you know, or rake the leaves, those types of things, which, by the way, is huge for the grandkids.
And
Even
the
if they don't
time
know
frame,
it.
the time frame
Yes.
of it too, right? That, boy, I need it done twice a month. And if you let me know when you can do it, that's great, and I'll make sure that I have the gas for the
Whatever,
mower, or I'll make sure I'm not home, because I kind of have a personality conflict with you. You know, because that's part of it too, is bringing in supports that maybe they're not, you know, maybe it's a challenging relationship. But we don't have to, but it's always nice to find ways to make those work too, right?
That's often the way with siblings. You know, there's a couple of siblings that can't be in the same place at the same time. Well, don't set things up to be that way. Do your calls over Zoom and telephone. And then when one's in the house helping in this area, the other one's not due to arrive until the next day. So we have to balance these relationships all the time. We are doing large balance.
Yeah, and I'm exhausted.
Yeah, we just got started.
Yeah, yeah, I'm done.
We're ready for a
So-
couple more hours of this.
Yeah, well,
Hang in there.
I think that's part of this, though, is if I'm the caregiver and all of a sudden you got me to a place where I wasn't before. Okay, I got a network now. I love this, but I got to coordinate this.
Well, you could be the coordinator, or you could assign someone else to be the coordinator. Here's what needs to get done. Here's the idiosyncrasies of relationships. Here's some of the boundaries. So just like everything else on your list, it is a task that can be delegated, providing that you provide the right boundaries and expected outcomes and time frame.
All right, so I put this one back a little bit, but we've got to figure out how to ask for help. Or we've got to figure out how to get Dad to ask for help, or we ask for help for him or something. Tell me, how do we start this process? How do we ask? Or how do we get Mom to ask? You know, Mom, who was always there with the casserole, right? She was the first one there with the casserole. Or in Idaho and Utah, the funeral potatoes, right? You know, the morbid potatoes. They were the first one there, so asking is not their best skill.
Right.
How do we do this?
It's tricky.
And it's different for every situation.
Right.
I'm done.
Right.
I am now done.
Yeah.
I was exhausted before, and now I'm just,
So you have to know the person that you love and care for. And, you know, one of the things that gets right down to it is sometimes is just saying, Mom, I need help. I need help, and I want to do this for you. I want to be part of your team. And that's how I talk about it. Melissa and I were talking about this earlier. I just refer to always the team. And that it was that we're a team, and one person is the team leader, but ultimately our client, as long as they have capacity, is kind of like the team manager and says how things are going to go. And then we have the coach, and then we have other team members. So there's still a bit of a pecking order in this. But it's that, where are the points where someone will be receptive? Well, Mom, you remember that you've done this over and over and over for all of your friends. And now your mission is to learn how to receive. And that's an important part of being a caregiver, is learning how to receive, being on the other end of it. So there's little things that, you know, as you sit and just think through this, is like, well, what might resonate for them?
So often we have families who maybe the wife caring for a husband, and husband has memory loss, and she does not want to leave him alone. So trying to find someone to hang out with husband so that she can have some time. But husband is, I don't need a babysitter, what, we're not doing this. And part of that conversation is often, it's not really about you. It's more about your wife. Your wife is uncomfortable, it makes her nervous, gets her blood pressure going. It would make her feel better just to have someone here with you. Can you get on board for your wife?
And most of the time they will.
Okay.
Because they've been used to taking care of their wives or being a support system, and so they often will. Okay, this isn't about me, this is about her, fine, that's good. So that's, whatever way in works, and it starts little, and then as things go successfully, you can add other areas where you can provide care. But you cannot effectively walk in and be the bulldozer and take over. It will be a disaster, I promise you. Nobody likes to be bowled over. Now, in crisis, yes, that's what we have to do, but we're here talking about pre-crisis.
Or post-crisis, because
Yes.
that subsides a little bit, and now we're fully implementing a plan, right? And so to me, then,
Yeah.
we're back to that.
Well, let's make sure, and part of the strategy there is let's make sure that we don't find ourselves in that kind of
Again.
crisis again, at least not like this as unprepared. So let's try and do a little preparing and planning.
And I think back to just one more thing on asking for help, part of that is also being prepared for when help is vaguely offered, right? So that person who's,
What?
if I can ever do anything, let me know if I can do anything.
So
And
you get their information, you write it down.
and you have your list, and
Oh,
you're
there you
like,
go.
actually, I've been trying to find someone to mow my lawn, or actually, my mom, I believe my mom goes to the same hairdressers that you do. So being prepared to take advantage of opportunities as they arise. And if the person is like, oh, well, then you've kind of screamed that person out, and or you understand a little bit more where or how they might be able to be involved or not be involved.
Well, and offering them options too, alternatives. Well, maybe that's more responsibility than they want. Well, what about, picking up the groceries that we need once a week or whatever. So if they're not responsive to one and they've made the offer of help, don't give up.
Right.
Very good.
Push
it a little bit.
Inviting dad to your car club or the card game that goes on at their house.
Oh, yeah.
A lot of creative ways I don't think people just think of because we have to remember too that the person that we're caring for, they often, well, all of us, whether we realize it or not, need different social interaction. We need connection with people, and if it's just you and the person you're caring for in the house, they need those other relationships just as much as you do.
Yes.
Yeah.
Yes.
Right?
Yeah. Oh, absolutely. Absolutely. So, my mom's is a nice little place in Logan, Utah, and she has learned to accept the help.
Nice.
And she's very polite about it. She's very grateful and gracious. And you walk in the door and you say, and they'll see my name. Oh, you're Mary Joseph.
Mm-hmm.
Oh, yeah. And they all know Mary Jo, every one of them. And that just attracted help. So she's got a little med tech that comes in and watches Jeopardy.
Nice.
Just
Nice.
every day, Jeopardy's on. He finds a reason to be there, to sit down and visit with her. But that for her was an acquired skill. It was not natural because she was the one there with the casserole every time and all the kinds of things that we did. But the reward for that was the fact that the people will stop in, and she gets visits from the CNAs who have moved on. They live on the other end of the state, but if they visit Logan, they go out and visit her. But that's an acquired skill. So if I'm in the middle of this, or I'm seeing this and this is gonna happen or it's happening, where can I go to learn all this? I mean, we talked about this is great, and it makes a lot of sense, you know, we're fairly conceptual learners, and so we see it, we can apply it, but man, there's a lot of stuff that you two talked about that's not in everybody's toolbox. Where do we learn this?
Well, you use the experts in the field. You use Janice and all of the many programs that they have that are so wonderful and really approachable. I mean, it's a minor amount that they charge for powerful tools for caregiving, and I know that they do scholarships at times.
Actually, the Powerful Tools for Caregivers class is now free.
Oh,
Like there's no charge for it anymore, and I really recommend that as a good starting point for many
Foundational.
people. And
Absolutely.
one of the things, we've been hosting that class for decades, over, I don't know, almost decades. And the one most common comment from people who have taken the class is, I wish I had taken this sooner. And the Powerful Tools for Caregivers class, it's a 6-week series, meets once a week. It's not a support group, but it's like it's a supportive network of people. And every class has resources that help you support the tool that you learned in that class at that time. So for any caregiver through the lifespan, I think it's a great way to start. And
Okay, it sounds wonderful. How soon is sooner? Everybody said, I wish I had done it sooner. When's sooner?
Well, if I could do it again, I would do it before my folks needed it. I like to have a skill before I need it. Because when you need it, you're now under a lot of stress. So I don't think you're too early to learn these kinds of things at any point in time.
And I would say for people who are, like when you're starting to think, wow, maybe I'm going to have to help my parents pretty soon, that's a good time to start.
Right.
That's a good time to jump on board and go, okay, then you'll have those tools as you move forward.
Yep.
Yeah, that's what I think.
And there are a plethora of books out there. If learning is the way to go, learning by books is the way to go. There's lots of caregiving books are out there, some disease related. I mean, I think everybody that I've ever talked to that's read the 36-hour day gets a really good sense of how intense caregiving can be. So you don't have to read the whole thing, but it's another resource that'll give you some big picture about the things that you need to be thinking about, and there are a lot. This is a skill. There are people who are professional caregivers, and those that have good caregiving skills. And right down to the literal skill piece of, I was telling Melissa, when my dad started his road of dementia and he became incontinent, that it was the professional caregiver that I brought in to help me because I was still working. And she taught me how to change a pull-up without taking his pants off. And that was the day I just couldn't believe it. Oh my God, I don't have to, take his clothes off and get him dressed again. I didn't do that, and he always loved that. He just thought that was the funniest thing. So there are skills out there that you can learn, and there are some websites that literally do caregiver training, and there's not a lot because they tend to be focused on home care companies, but MMLearn, it's MorningsideMinistryLearn.org, has a plethora of resources out there about literally how to take care of somebody's, genital area when you're cleaning them after they've had an accident, and how to do all sorts of things. I mean, I've been recently doing feeding tube training with caregivers, and it's like, okay, I learned this by accident, but there's places to go physically learn how to do a feeding tube. So if you can Google it, you can find a training on it.
So a little bit of feedback, and then we need a good takeaway from each of you if they didn't get anything else. The takeaway to me is, first of all, you're not alone.
Right.
Second of all, you can know it.
Yes.
I mean, it's available, and you can learn it. Or you can find somebody to help you learn it. Those are the takeaways for me, because I know how scary that is for people, and that being alone is really scary.
Yes.
What
that team that you're creating is going to help caregiving, help you be a better caregiver, and help the quality of life of the person that you're caring for. And there are tools out there.
Very good.
For me, is getting clear about good communication skills,
Ooh.
because we have to communicate what's going well, what's not going well, what needs to be done, differences of opinion. Melissa and I talked about the seagull earlier, that where somebody from out of town flies in and poops all over you and everything that you've been doing.
I like that one.
And
We see that a lot.
yeah, and so that's the reality of it, but how do you then have a conversation with them to bring them into a way to contribute helpfully
Yeah.
and not make you feel bad? So communication skills, a lot of I statements, help me understand, I'm confused, good communication. And again, there's places to learn those skills. If that's something that you didn't grow up with innately,
Yeah.
there's places to learn good communication skills and people to help.
Very good. Melissa D., thank you very much. I know we could probably do a full day on this because there's a lot of information packed in there. Thank you for being here with us. Time for a bio break. Come on back. We've got more today. Thanks for being with us.
Thank you, Mark. Thank you. Nice.
That was fun.
Yeah.
Yeah, there's so
I found my
much.
circle, so if you
Oh,
want
there
that.
it is, yes.
And
Yeah, there they are.
I'm looking at it, and then I can send it to you electronically if you want.
Sure,
Yeah.
sure. And we can put up a link to your website
Perfect.
so that people can grab that as well. We recorded this today,
Okay.
and so we'll get that posted. We'll have
William.
did you turn me off?
Yes, I did. Just for a second, I want to check something.
Okay. So we'll get you the link, the address,
Oh, great.
and then you can,
Put it on the website.
Yep.
Yep, great.
whatever needs to be done.
I'd like to have the whole conference to be able to put on the Learn website too.
Oh,
you
yeah.
got it.
I think that's huge.
We could probably do that. Here's my lunch.
Here's your lunch. Coordinating care is over the top of So we just run them through this process over a couple of years, and here we
some really good discussions today, and the last one, if you're looking at the image on your monitor and you're going, wait a minute, there's people the same on this one. That's true, there is, you didn't do anything wrong. We, and it's D, and we'll talk about D again in a minute, because I know there's some people on for the first time. But we had such a good discussion that last time that she's still here. And
She likes to talk.
And, you know, she does a good job talking too. She reminds me of somebody. I don't know who, I'm not sure she reminds me of somebody. So again, welcome. This is our second annual No Place Like Home Conference. I'm Mark White. I created a law firm called Idaho Estate Planning. We do estate planning, we do elder care. We work with families in particular, and we really, really try hard to avoid the crisis, or at least be prepared for the crisis. We talked yesterday about this. Mike Tyson, that philosopher, the boxer.
Yes, of course.
And he bites people's ears off.
Yeah.
He said something that was brilliant. He said, everybody has a plan until they get smashed in the face. And you know what, that's so very true, but if you don't have the plan, you don't have a place to go after that. So we try to get families to work on that. We have a couple of sponsors. We want to say thank you, Home Instead and Blue Cross of Idaho, the True Blue Special Needs Plan. And we're here at Garden Plaza at Valley View. I mentioned this earlier, it's one of the few places I've been where I got yelled at by old people. We were scheduled here to play the Old Man Band plays, and we were here, we were set up, and they were playing cards in the next little portico, and they came and asked us to turn it down. Didn't even think they could hear it. And so the whole thing for this conference is kind of a multi-generational approach. I know the two of us at the table today have been in the, if not still are, in that sandwich generation. I won't speak for Sarah just yet, but we've got kids that we're concerned about, and we've got parents that we're concerned about, and so trying to throw out a little bit of help to do that. So that's what we're trying to get done today. And now we're going to talk about how to come up with a plan. Oh yeah, a lot of work. We got work to do. I was exhausted after the last session just listening to all of the things. Oh my gosh, I don't think it's any better.
Imagine doing it in a crisis, emergency.
I think I said that exact same thing. It's like, oh my gosh, oh God. So immediately to my right is Dee Childers. She was with us just a minute ago. She's the owner and the life care manager at, hold it just a second. We don't have your
Life Changes Elder Care Consulting.
Yeah, I knew that, but it wasn't right here, so I was lost. That's talk about a crisis. I just crisis
We
avoided.
pitch it. That's what we do in caregiving. That's what we do at the table.
Right?
Right.
Oh my gosh. And your plan at 7 o'clock in the morning isn't necessarily the plan at 7:30. So,
701.
yeah. So we move forward from that. Dee was in the corporate America for a number of years. We won't say how
long
many.
time.
We won't say all the years.
Okay, good.
Just a little
I
bit.
appreciate that.
Which, by the way, as working in human resources, which you may not think of this right at first, but if you think about it for a minute, is great training for what you do now.
It really is.
Because you are maneuvering, you are negotiating and mediating and
Managing risk.
And very good, very good.
Yeah.
Now you're a life care manager. You do mediation. I know you've been involved with the Alzheimer's Association. Got a support group for the early stage. Anything else I should mention?
Just that we are, the easiest way to explain what a care manager is we're like the hired daughter, except for we have experience and expertise to help you navigate the path. So.
Oh, and I think one other thing that the daughter has that's really hard, and that is that emotional attachment. I'm not saying you're not emotionally involved, but you can take a step back and make some decisions, or at least give some help, where the kids, we can just be blinded a little bit.
A client's daughter the other day said, "Oh, thanks," when I said, "No, you're here. You're here at this point." "Oh, okay." She just needed a little clarity there.
Yeah, no, we're not done, and I'm not doing it all. Yeah, we're only here. And Sarah Lowe, I only met just a little bit ago, and so thank you for being here. And grandmas are the best. That's all I'm going to say. Grandmas are the best.
Yeah.
Talk about having the casserole after the funerals or whatever. That was my grandma. Oh my gosh. Holy cow. And so you have recently created Emerald Senior Care.
Right.
Tell us a little bit about that.
So it's a home care agency, but what I envision it to be is more, educating and connecting people with resources. So yes, home care, I love home care, but I want to educate people on all the things out there that they can and should take advantage of, before they get to that point of home care.
Yeah. Your background, your educational background is healthcare administration with a particular concentration on geriatrics.
Right.
I know that you're very passionate about what you do. In fact, both of you are very passionate about what you do. I'm very passionate that the two of you were passionate about that.
I'm passionate about that too.
I got enough to do. I can't do everything.
Yeah.
So, yeah.
We're a team, and we have to do what we specialize in and use our expertise. And I'm not an attorney, and I'm not a caregiver, although sometimes that's debatable. So yes, we can be part of a team.
Yeah. Well, and the team, I was thinking this earlier, this is really kind of silly, but they talk about certain athletes being the greatest of all time. They're the best whatever. And the last I remembered, nobody won any of these games by themselves except tennis and wrestling. But basketball, football, baseball. You still need the rest of the team because everybody has a gap. Whether it's we don't see it or we don't have the training, whatever it is. Anyhow, so very good. Thank you, thank you. Thank you for both being here. I think what we're going to try to talk about, we talked about recognizing or developing, our support system, because I don't think people do.
Right.
I just think they walk in and so many of them are, one, exhausted, and two, they just know they have to do it by themselves. Whether it's birth order, or whether it's because they're a spouse, or whether because mom or dad made us promise, whatever. So this is in my brain, I guess. This is the next step. Got a network. Awesome. That's why I was exhausted when I said, okay, so now what do? You got a network. So what? And you said, well, you got to have a plan, and then you got to fit the players in. So talk about a team when you put together your network. That's a pretty big team, and so that takes a little bit of work.
True.
So tell me, how do we start? You sit down with my wife, and she's trying to take care of mom, and she didn't know where to go. We get the network put together. What's the next step? What do we do?
Well, I think that a lot of us think that the plan needs to start when there's a crisis. And I think the best time to start the plan is before there's a crisis. And this is the plan with mom and dad, this is the plan with you, and this is the plan with, your adult children with grandchildren. So we all need to have a plan because stuff happens at any point in time. So this is not just the late stage of life. This is about anytime something can happen. And so to think about, not only are we focusing on plan A, but when it gets right down to it, we kind of need to have plan B and C, because undoubtedly plan A, something will come in. So the best plan is what you hope for, but we do have to have A's and B's and C's. And so I think information is key to planning.
Yep, I agree. My father actually, so he's not an elderly person yet, but he ended up with wet macular degeneration. It very quickly went blind and their whole world went upside down, and so there wasn't a plan in place. All of us kids were kind of scrambling and, figuring out what are we going to do to help support them. And I think it's important to figure it out ahead of time, and that way it's a lot smoother.
A lot easier to implement.
Yeah.
And it's less threatening too, because now we're being proactive about it. This is like at some time in the future, we have a plan in place. And so part of that plan does start with, agreeing to talk about things that we need to know, which is, my father said, here's the file cabinet, you're my financial power of attorney, here's the file cabinet, and here's everything you need to know. And 6 months later, I dug myself out of the hole of all of the accounts that he had and all of the investments in the bank accounts, and it was a quagmire. So when I talk about planning in that regard, I talk about a lot more detail in the plan and being willing to share information. If your loved ones have decided they want you to be their representative, i.e. their power of attorney for either healthcare or finance, then hopefully they're willing to share their specifics with you. And so gathering data is really important initially.
Okay, so you said something that struck me, and I think we talked about it a little bit in the last session, and that is we can't plan around Dad. We can't plan around Mom.
Right.
They've got to be a part of the planning, and so seeking the permission.
Exactly.
And that's
Again,
right up front.
Right.
And doing it sooner before there's extra emotions involved in it.
Right.
We get calls all the time where it's like, can you meet me at Starbucks? Mom doesn't know. Don't bring any paperwork. She doesn't know.
Oh my.
We're setting that up to fail, so having that conversation, it helps.
And long before it's needed. So it's just, we've normalized it.
Yeah.
And that is probably one of the most helpful things. Have it early when it's not necessary, so that you've normalized it. Everybody knows we talk about these kinds of things in our family. The people who, you might want to keep it narrow. Maybe there's just certain people that you want to know about your finances. And that can be the financial power of attorney, but at least they have some sense of what that looks like, so that when, they've hopefully been to attorney and done some estate planning, and we know coming into when there is a situation, how long can we keep somebody at home with care? How long, when might they need to make some alternative arrangements? So planning is about information gathering up front, and that's financial, it's health-related information, because we're always going to ask you what's your H&P or your health and physical. So we want to know what your diagnoses are, what are your medications, who prescribes them and for what and how much, and who your practitioners are. And that's like just foundational. Everybody should have that. We need to have that list. So we kind of go through the process of information gathering and sharing with those that they're comfortable with.
Stephen R. Covey, efficiency kind of a guy, he talked about getting up in the morning or the night before and putting together your day. Here's what I'm going to get done today. And he said, after you get all that done, I don't care if you use that again, because you set your priorities, you've gathered the information, you at least know what needs to be done. And so it seems to me that it's a very similar thing. And what you just said sounds huge to me, even if that's all they got done, was to get all that information. They're so much further ahead than, what, 99.5%?
Yes.
Well, Sarah, that just makes your job easier if you have even that much information.
And it makes it better for the person. We know their favorite things. We know how they like their coffee in the morning. We know who to call when there's an emergency. We know all of that ahead of time, versus coming in and they're already in crisis and now they're frustrated because we didn't take the trash out and the dog didn't get fed and, you know, whatever else, those little things that people don't always think about.
Dee, you talked about last time about, well, they didn't get the right stuff at the store, right?
Mhm.
They got the rice, right? We got rice, but it wasn't the cheap store brand,
Yeah.
or it wasn't the more expensive, you know,
Yes.
that's, so getting that information, which, what do you think? That's not a one-time, it's not a one-time deal.
No, because it evolves over time, and that's fine. Nothing is going to be perfect and forever, but it's a start. So it's
Start the
easier to take
conversation.
something that we have and build upon it. You know, I've gone through so many different diets in my life. You know, I'm plant-based right now, so that all the meat section would have to come off.
I'm sorry about that.
Well, it didn't last
Send it
long.
our way, right?
It did not last long. So fortunately, I've learned just create versions. Don't
Oh, there
edit
you
the
go.
same documents.
Yeah, there you go.
Save as. Then I can go back and add it on again. And the same is true, you know, with us, the rest of our lives. Now we're on low carb. So, you know, even just, it's amazing how knowing just people's food preferences goes a long ways with making people happy, because that is a happy thing for us
Yeah.
is eating. So knowing what that
Well,
looks like.
It is for me.
Yeah.
It seems to me that there's a temptation here, that if you spend a lot of time with mom or with dad, you don't need to ask all those questions, because you already know.
Mhm.
It seems like that might be a little bit of a trap.
Yes.
Mhm. Big time. We also find that mom and dad are often more willing to share with us or accept advice from us than they are an adult child. I mean, it's a role reversal very quickly for people, and you know, it's hard. People don't like that. So knowing ahead of time and bringing someone in that can help, and just setting all those things together of what you want it to be, the whole thing just goes a lot smoother.
Yeah, I found that even though I'm the estate planning attorney, that I really don't know much about estate planning. I found that to be the case.
But you at least get them set up to hand off to the next step.
Yeah.
It's like an assembly line, you know, each one of us have our own piece of it, and together it makes something work really well, but you start getting them out of line, or you're missing certain parts of that assembly line, and
Okay,
that
so
doesn't work.
let's say somebody's listening and they go, great, I know to get going. We'll schedule a time with mom and sit down, and what do we do?
Well, I think when it comes to this kind of planning, I think we have to start at kind of a core foundational piece, which is seeing an attorney and getting your
Yes.
advance directive set up.
You have to know what you can afford, what it looks like for you, so then you know what your options are.
Right. And you start the process, because literally, once we turn 18, we should all have an advance directive, because it's no longer default. Mom and dad by law are our decision makers. We need to decide who we want to make decisions for us, and then have conversations with them about what kind of decisions we would want them to
Yeah.
make. If we were not able to. And I think, you know, that people misunderstand between healthcare and finance when, you know, healthcare, nobody has that right to make decisions for you unless you don't have the capacity to do it. Either you're in surgery, you know, you've had a traumatic brain injury, whatever it is, you don't have the ability to make decisions. Versus financial, we know is different. So we need to make sure everybody understands the role of those very important documents, and then we need to share them with the people
Yes.
that have that authority, as well as our healthcare providers and hospitals in our area. It doesn't matter that I tend to go to St. Al's. Luke's needs to have it too, because sometimes if it's a cardiac event, they're going to take you to Luke's. If it's trauma, they're going to take you to Al's. And so you want to make sure you're prepared. To me, that's just a really foundational piece of the plan, is estate planning documents.
Okay, let's say that we got them moving, and they came in, and we visited, and we have a pretty long conversation. This is not just a, you know, one and done. There's some work to be done. So we got that part, and that's huge, because should tomorrow Dad wake up and is non-communicative,
Right.
we now know who can step in and make financial decisions, and who can step in and make, you know, healthcare decisions.
I've seen kids come from out of state, all of a sudden there's some crisis, and they're like going through every drawer, I don't even know where she banks, look at all these checkbooks, and I don't know where the money is, what should I pay out of? Oh wait, I don't have the authority to do that even, you know, and it's just this confusing, scary time for them.
Yeah, we've been there with some folks.
Yeah.
Now, a cheat, if you will, is that there's a number of places where you can upload your documents to the cloud.
Great.
Not just, you know, healthcare documents, but you can also upload a financial power of attorney, a will, or a trust. Those documents can be uploaded. And then with a card,
Which is going away. Sorry.
well, it's transferring, right, in Idaho?
The registry is transferring, but you will no longer, that card will no
Oh
longer do
my gosh.
anything for you.
Okay.
So it's not, you don't have a password and a username that's given to you, and that has just come into effect like this week.
Oh my
At the
gosh.
end of this week, that changes. So the registry, Mark is talking about the Idaho Registry for Healthcare, or for directives, and that's gone from the
The Secretary of State.
Secretary
Which
of
was really an
State.
interesting place to have
It
it in
was,
the
but
first place.
they probably said, okay, we'll do it, to health and welfare. So
Yeah.
that has all moved over there. So some changes happening right now, you'll hear more about. But the bottom line is there's a place that those documents can be uploaded to, that are accessible by those that need to have access to them.
We use a private group that does that, and so our people are still hanging on to the card, which is nice to have, by the way. And so there's that's a little bit of a cheat. We have the electronic copies that people can have. These things are available, and hopefully we'll get them past the. I don't know what we're doing. All right, so we got that step done. What next?
For me, I think the next thing would be to have that conversation, you know, does it make sense for the adult daughter to just, she's gonna be the one that's gonna handle everything while she's working and raising 4 kids, and
Well, of course she
go to
is.
soccer and everything else, or does it make sense to talk to someone now, like Dee, that can help you kind of organize all the moving pieces, because it's a lot for one person to manage, let alone when you're managing your own life, and it often creates kind of tension between families, and we see, you know, problems with relationships there.
Oh no, it's impossible. It's not just difficult.
Yeah.
That's impossible.
Oh,
And so the expectation is very often that's the plan. What's the plan? Well, you know,
Dee will do it.
yeah.
Yep.
Dee will step in and she'll take care of Dad, and that's how we do it. And that's it. That's the whole thing. So you're suggesting that we might start there with that conversation.
Because a lot of the questions she's gonna ask are gonna drive what the next steps are gonna be. You know, they already know, okay, this is what the finances look like. And now Dee's gonna start asking these questions of, what do you want your life to look like? What do you envision when you think about retirement? And so that kind of shapes everything else kind of coming in to play, I think.
All right, so, yeah, but tell me how you do it. It's a sit down? Is it the whole family's together? Is it just me and Mom and Dad? How do you see this happening?
I think it really depends on your family system, because families are so different, and there are some families, you know, one prominent family in town that I was working with, and when we had meetings about this kind of stuff, 8 of them showed up, and they were effective meetings, and people learned things about each other, and there are other families that would have been a total disaster. And so we start small, so we need to look at the dynamics of the family system, and so it might be just a couple of people with another person who's kind of mediating, taking notes, and asking good questions. And once it's resolved or kind of agreed upon amongst the 2 of them, then you might take it out the next step. So you have to look at what your family dynamics are. This is another time, there's no one way that works. It's just something has to happen.
I about had it down here, now you're
Yeah.
telling me I don't. Okay.
Well, you know. So for me, one of the things that I make my life decisions based on values, and it took me a while to get to this place. But, you know, it was, not Cubby, who's one of the other Chicken Soup for the Soul guy.
Oh, yeah, I can't tell you.
Successful strategies.
Yeah, I know who you're talking about.
And doing the work about values, I found so incredible to help me make decisions in my life. And I think that's true about how we want our lives to look at any point in time, but certainly in decisions about medical and decisions about where we want to live and decisions about who we want in our life, we need to get clarity about what our most important values are and have conversations with people about that. So we do healthcare power of attorney for people who don't have anyone. And so we literally have a formal process we put them through. And these folks tend to be younger in their 40s, 50s, and 60s. And they're like, well, why do I need to do this now? I'm young, I'm not gonna die tomorrow. It's like, well, one, you don't know that.
I hate to be the one to tell you, but
And even more difficult is you don't know that maybe you'll just have something happen to you where you do not have the ability to make all of your decisions on your own now, so you need help. So let's make sure that people in your world who will be helping you with these things understand what's the highest priority for you. And sometimes, you know, it's not one of mine, but living in my house to the end of my life is often one we hear.
yes.
And yet, you know, I find that home is a state of mind, where you feel comfortable, where you have your important things with you, where you have memories. A house is a container, and it's not the only container that works. But if it is, then we need to really understand that and see, you know, is it a home that can be modified if need be? If you've got, you know, a walk-up of 2 stories, that's probably not going to work for you as you
Tiny
age,
little
'cause-
bathroom doors. that we
Right,
can't get in.
right.
Or the washer dryer in the basement.
Yes, with
Yeah.
Of
Ricky's.
a 1960s home, and yes,
And the rug
In
right
the
on
north
top
end.
of it.
Yeah,
and there's
yeah.
scary stairs,
Yeah.
and the only way you can turn the light on is if you can find, you know, the string somewhere.
While you're balancing.
Oh, yes, yeah.
Yes.
My grandmother's house was the coal-fired furnace. And so rickety stairs down underneath, that opened up and it was black and there was coal dust and there was coal, and a few times we had to go pitch the coal into the furnace, you know, and that's just scary. But that was her home. That really was. And man, she was very intent on staying there and made it very difficult for everyone else.
I think sometimes, you know, people have this vision, well, a lot of times in their head of well, that's just a nursing home, you know, and whatever vision it is from maybe it was 50 years ago of what they saw, that's still stuck there. And
Yeah, Sarah, some of us remember 50 years ago.
so,
And we had that experience.
Well, and assisted livings only came around in the 80s.
Oh, I know.
I mean, we think
Yeah.
that that's just been there, but no, I mean, you look around in this community, they're very different. They're not nursing homes. These are independent, assisted living communities, and they are communities. They're not facilities, and I really want everybody to quit using that word, because we're not housed, we live in community. And, you know, you get to choose how much you participate or not, but I think it's more important to figure out what's the most important things in your house. What is it that, you know, I realized this when I lived in Florida, and Hurricane Floyd was coming, and I had to prepare to evacuate, and I had to figure out what I was going to take with me. And I looked around at all my stuff, and I went, oh my gosh, this is stuff. And what was most important to me was my music, and it was taking up my whole car. And so now it's all on MP3, so
There
now
you
I can
go,
take
yeah.
more
Oh,
things.
yeah.
But you know, that was a crisis moment that made me really get clear about what's important to me, and it's not all my stuff. There's a few pieces that are important to me, but I found my music, my photo albums, a couple of gifts. So when we think about things, what's the most important, it really doesn't have that much to do with the shell. It has to do with our stuff, and which is the most important stuff, because most of us can let go of a lot of our stuff.
So, I feel we jumped a little bit ahead because we started talking about what the concept of home. and I get that. How do we get there? You know, we've got the estate planning done, so we've got some people picked, but we still, you know, have we decided, or do we need to decide who the executive officer is that's going to, you know, organize and make it all work? Is that something we need to get
I
taken
think
care of?
having that conversation, sometimes you find, you know, oh, I didn't think my mom would want that, or I can't believe my daughter doesn't want me to stay home, or, you know, that's where some of this, so maybe having these conversations help you decide, yeah, maybe having my daughter or my son isn't gonna be the best option for me. Having someone else that can
Oh,
step
got
in and make sure that my wishes are followed.
That they understand, again, it gets back to values, that they understand your values and your priorities, and they're able to make the decisions that you would make if you had to, or you
Got
could.
it.
So that's core. And then education, I think, is the next piece. You know, gosh, some of these places, these communities have like excellent food. Now, true, we're in the time of COVID, so it's a little weird to go tour communities. But over at different points in time, it's easier. But I think education is really key here. So just go take a look, and people are like always amazed. Wow, this is really nice. You know, I would move in here.
And sometimes they can go, you know, if they have an in-home caregiver or family member, whoever it is, they can go have lunch with their caregiver in the facility, or they can go, you know,
In
just
the community.
Yep, yes, in the community. You know, and kind of get used to it, but it makes it a little less intimidating that they're going into the community,
Right.
and seeing it ahead of time.
So, for Mom, she was struggling with the concept. She knew that's where she was gonna end up at some point. The timing was not her best, you know, she didn't like the timing particularly. But one of the things we did was, we were gonna be in Utah for a week, my wife and I, and we've got kids down there, and we said, how about, Mom, we buy you a week at this place that she looked at, and she quite liked it. And so we bought a week, she went and stayed there for a week. Now, that almost backfired, because the first thing she did was breakfast the next day with a lady that was 110. And of course, what do they always say? When you help them to move in, they go, you know, I'm too young to be here. Yeah. So that was the first thing she said, well, I'm too young to be here. I'm like, well, that's true. So 110, her son was almost the same age as my mom, and he would come and get her up in the morning and bring coffee, and I'm like, I hope this works. Yeah. Anyhow, so education, but she did actually realize, I think in that experience, that it was not a home. That
It was not a facility. She's not being housed.
Well, yeah, but we called them homes, and it was the home, you know, and every little town had one. Here's the home,
Right.
and we talked about it in those terms, and we have bad memories of some of those homes.
Oh, yeah.
And so they do too, and so
Right.
that's how they see it. So
Exactly.
I love that, and get them out, and I would guess that who helps them to do this might be important as well, because if you've got the son, I'll pick on boys for a minute, who's going, Mom, you're not going to be here. And of course, he says that because he's not going to be a caregiver either. I think that would be, again, I don't know who's coordinating this, but it seems to me that would be important to understand who's helping to make that decision.
And just having the patience, because it can be frustrating for when you have to go. We don't have another choice, or, you know, just the patience. Because if you get into a power struggle, then no one's going to win in that situation.
Yeah.
Well, and sorry to bring it back to values, but back to values again, that there are some really nice, very contemporary communities.
Yeah.
And that is not what Mom would like at all. Mom would like something a little more homey, a little large.
Yeah.
I did that with one community when I brought my mom down here, and I thought, this is where I want to live. And she goes, it looks like a ski lodge. I don't want to live there. It's like, okay. I thought it was like super sweet.
Yeah, and
So,
my mom would be looking at, oh my gosh, how much does it cost to be here?
Right.
Well, Mom, but you could, no, she could, but no, she's not gonna live there, because that's not who she is.
So that's one of her values, because
Yeah.
I'm still going to be thrifty. I need my needs met, but, you know, spending all my money because this is a place you would like me to live is not okay.
Yeah.
So yeah, it gets right down to that. And
You gotta
it's,
think about the spouse, what their current diagnosis is, or maybe what they might be facing. How important is it that you guys are housed together?
Right, very good.
What you're looking at with that as well.
Yeah, and so,
or not.
Yeah,
Yeah.
yeah.
a
That's
spouse,
a vacation for some.
a spouse who is the caregiver for someone with, an Alzheimer's dementia, there is a real pull to be together.
Yes.
And you can't do that everywhere. And so that would take, from what I've seen, that takes a little extra work to make that
Be
happen.
creative.
Okay, so patience,
Mhm.
and stick-to-itiveness. That's a better.
That's a great stickiness.
But hanging in there and not giving up,
Right.
which is not the same as patience. Patience is being, gracious and, but hanging in there to make sure that it gets done, that's not everybody's skill set either. And so, that would be a family situation, tag team.
Right.
Your turn. I softened you up.
Exactly.
It's your turn. You go on in there.
Right.
For my dad, it would have been, I know which daughter. There was the daughter, and that would have worked just fine. With mom, I think I met with mom. Not that I necessarily relish that, but I think a little bit that's the one. Not that I'm the favorite son or anything. But this would be
She
mine.
knows you're protective, you wanna take care of her, you're gonna make sure she's okay.
Well, and I think that's important. I thank you for saying that. I think that's really important because I've seen parents who felt like they were just being put
Yeah.
into a home. I hate that too.
Mhm.
I'm putting them in a facility.
Yeah.
No, and
Yeah.
they don't want to be put anywhere.
Right.
So that might be really important to get the right combination of kids and parents and resources together to have that conversation.
Right.
Okay, so if we start back soon enough, then we should revisit this on an ongoing basis.
Yes.
I think you said normalize it.
Yes.
Normalize that conversation.
Right.
Yeah, okay.
Right.
And a suggestion from my side would be normalize helping with the finances.
Yes. Absolutely.
And I don't see that a lot.
No.
Not till Dad's gone, if he was the one doing the finances, or Mom's gone and she was the one doing the finances. I find that with dads, they get a little protective about you knowing what's going on, right? If they were the one doing all the investing and there isn't, a couple $1 million there, then they're feeling a little, I don't think you need to know this, but boy, do they.
And even if that starts with just a conversation with, okay, you're gonna go meet with an attorney who's gonna help you plan for this, and then you'll know what it is, and so you can start sharing, I'm gonna have in-home care, or I'm going to go to, a community, whatever it's gonna be, starting there, at least someone knows, and that information is organized there, and they know who that's gonna go to, and then it gets a little bit easier to then bring in that person that's gonna help.
Yeah. So if we start small, maybe the favorite daughter, and there is some disagreement in the family over who the favorite daughter is. All the kids except her think she's it. So I'm not the favorite. Yeah, you are. So now we expand that, and this I see as man, I'm not sure I want to be there, but thank goodness we have you. Is bringing the rest of the kids. This is now a family situation, right?
Yeah.
And we have that initial conversation, and then we set up. Yeah, we're going to talk about this from time to time.
Which avoids huge, disastrous blowouts for families that can last forever because all of a sudden there's a disagreement about what we're gonna do with mom and dad. when we get to that
And or
point.
their stuff.
Yes, yes.
I have a story to that extent. A gentleman that I know, his wife was the healthcare power of attorney. Mom had a catastrophic event while she was in the hospital. the one daughter was out of the country, and the communication was not great. So my friend's wife had to make a decision, and she disconnected mom, because that's what mom wanted. When her sister got home, you murdered mom. And this went on for years. You murdered my mother. I don't know what you were thinking. So, absolutely, I think you hit that on the head by having that conversation and making sure that we have we call a family meeting after we put together a plan, and I have mom and or dad tell us, what are we doing? And I loved it because I had one gentleman, I was not looking forward to that family meeting because, well, it was an interesting family. He was very interesting. We put this together. It's a really interesting plan. Part of it because of other things that he'd done, part of it because just the way he was. He introduced that to the kids, and he said, and I loved it, this is my plan. If you've got a problem with this, you better talk to me while I'm alive. Do not take this out on mom or your sibling who's going to be, administering this. This is my plan. You got a problem, you come talk to me. And they didn't in that meeting, and I asked him later, and he goes, no one's ever come forward. And talking to one of the other kids, he goes, no, I think everybody's good with it. All they needed to hear was, it's Dad's plan. And we see that a lot, where they take it out on the oldest son and or daughter because they're now the personal representative or whatever, and they were mad at mom and dad, but you can't be mad at mom or dad, so you take it out on your sibling. So I just see that as being a huge part of the discussion, is everybody's now involved. We've had that conversation. And then maybe one of the positives out of the COVID is that you can have family meetings now from anywhere. We don't have to actually all be in town to do that, which is fine if we do. I have no problem with that. But we can have an annual meeting.
Everyone can feel involved in it and
Right.
be part of it.
Well, and the other piece I'd like to mention about that is family meetings, really to make the most effective, shouldn't just be about mom and dad.
Right.
It should be everybody's having these conversations about, this is what I want, this is what I don't want. Because any one of the family members could be affected sooner rather than later.
That's correct.
And so it kind of levels the playing field, because we're not here to talk about the problem people, mom and dad aging. We're sharing what's important to us in our lives. And so everybody knows, because somebody's going to have to make decisions for you too, so then you need to take that out and include those people as well.
It's a lot easier to make those decisions when you're empowered to do so. This is my plan, this is what we're doing.
Yep.
You've got the buy-in there.
I love the book title, Talking About Death Won't Make You Die.
Oh, you don't know that. You don't know that.
Well, I'd be dead a long time ago. 'Cause they laugh at my family, my reading list is death and dementia. And,
Well, there you go. Yeah.
So far I have neither,
Well, as far as you know.
as far as I know.
We don't tell her.
She said blissfully. No, that is so true. But I've had clients couldn't sign that will because they knew they were going to die as soon as they signed the will. Well, sign the will, they're not dead. That was 20-some years ago. Anyhow, really interesting. So now, one other thing I would like to throw into this is I have a sister who lives a mile from home. And so she's the one, she gets the call. She's done a relatively good job of keeping us all posted, right? Yeah, here's what's going on. There's a newsletter that comes out from the assisted living, and she forwards that to us, and then she, gives us the updates. Here's what's going on. I highly recommend that.
Communication is an amazing tool.
Oh, yeah.
Yeah, it really makes things go a little smoother when people talk to each other real time.
Well, especially for her, because you were talking about the, what did you call it, the seagull
Mhm.
effect,
Mhm.
where the kids come in from out of town and they just can't believe how bad mom's got. You know,
Right.
they don't see her on an
Yeah.
ongoing basis, they saw her.
Those are our emergencies. Well, mom said she's been taking her medication, but they're all here, and there's bottles all over the place, and there's meds still in the med box, but none of the days are the same, and,
Yeah.
you know, it's usually holiday times that get, you know, those crisis calls
We
for
get,
us.
well, we get the kids all together. Now, if it's a son, then that's what you see.
Mhm.
If it's a daughter that's helping, it's usually a little better. But you still get a son. I have stories. The one that came in, sat in on a family meeting, put his feet up on the table, and he's wearing $500 or $600 cowboy boots.
Nice.
And I helped him to get his feet off the table.
Sweet.
Anyhow, it's a longer story than that. That come in and say, oh, you know, mom's terrible, we gotta do something about it. And of course, their concept of doing something about it is to put mom into a facility.
Right, take
That's
over.
how they handle it,
Take over.
yeah.
Yep.
And that is so unfair
Yes.
to the daughter, and usually daughter, sometimes a daughter-in-law, that's been over there every day,
Yep.
checking in on mom, making sure that she gets, you know, some lunch. And all of a sudden, the seagull flies in, and it's not the way they think it should be. So I could see that kind of an ongoing conversation would be huge.
Well, and there is two sides to that situation too, which is when you're in warm, tepid water that heats up, you don't notice how
Yeah.
hot it's getting or some of the changes. And so there is some benefit to the outside, the folks that haven't been there as much. But how you handle that gets back to good communication skills. Let's talk about what I see versus you see. Because yeah, we do miss stuff when we're right in the heat of it and we don't notice the decline. So, you know, if we're gonna be a team, we're gonna play as a team, we're gonna respect each other and respect that happens, you know, with hot water versus tepid water. We're not gonna jump in the hot water. in fact.
You've had the same experience that I've had, where maybe a niece and a nephew, and they come, you get to see them after 4 years, and they're 6 feet tall,
Mhm.
you know?
Yeah.
And the mom was like, oh, yeah, because they were there the whole time. They didn't recognize this abrupt change, and so, very good. So, let me see if I can have a couple of takeaways, and then I'll ask you for your takeaways. One thing to think about is values. Where are we with values? What's important to them? And I think that'd be an interesting conversation, because they may say that the house is, when in fact it's not really the house.
Right.
It's the memories. This is where we gathered. This is where I raised my kids. And that can move us forward a lot better than, you know, it's got to be the house.
Yeah.
And then both of you mentioned this, the communication part. Be really well for us to develop communication skills, because we don't. How many HR departments do you think you'd have to have if everybody communicated?
Right. Not many.
We could-
It'd
we
be a
could
whole different job.
We could drop that off pretty quick.
Yeah, definitely.
Yeah, very good,
Yeah.
very good. Takeaways?
I think just planning and looking at all the resources out there and making sure that you've kind of got a plan in place and you know what supports you need, so you can make sure that plan carries you through. You've got a little safety net. Okay, if this doesn't work, this is our plan B or C or D.
Yeah, but you can't have a plan B or C unless you have
Plan
a
A.
plan A.
Right.
Yeah, exactly. Well, and one of the other pieces for me is that when things change for us as we get older, we want to make sure we hold on to who the person is.
Right.
Because that makes a huge difference for the people that are around them, being able to connect with them, being able to sit and have conversations, because, you know, whether it's in a community or it's in home, is that we want to give the caregivers some education about who this person is and what they've
Match
done.
Right.
with a good
And
caregiver.
so,
Absolutely.
yes, the match is really key to, I mean, yes, it's amazing, and Sarah does such a good job with that. But I think having a bio sketch of the person's life and you can write it with them, so maybe they tell you about stuff. But to have a decent bio sketch that you can then give to
Right.
whoever is coming into the home or wherever they've moved to, so that they have more information. Because, you know, quite honestly, my dad looked like a curmudgeon as he aged, and he could act like a curmudgeon. But when you read his bio sketch and what he did, and everybody was like, oh, MG, you know, this man has led a very full and comprehensive life, and maybe I don't need to look at him like a curmudgeon anymore. This is a human being. And so to have that piece, I think, is way under appreciated by families. And it's fun to do, and especially if you can do it with them, it's very fun to do.
Excellent, very good.
And the other thing that we were kind of laughing about it in here, because I have developed this tool, is like, here's the stuff for my care plan. And what do I want people to know about? If you're going to take care of me, I need to be by a window with nature. I prefer these kind of drinks. Do not turn the lights on overhead at night to check if I'm wet or not, because I will bite your head off. So low lighting. So there's things to be able to document our preferences and what will keep us happy, because there may be a point in time in our lives when we can't communicate that. So let's do it now. And it's fun conversation. I do these briefings with a group of people, and it's always interesting. Oh, really? I'm quite the opposite. You know, well, how do we communicate with caregivers if we haven't told them ourselves?
Nope,
So,
got it.
yeah.
Very good.
Yeah.
Well, thank you both. Thank you for being
Thank
with
you,
us
Mark.
today. And yes, yes, yes. Amen, amen, amen. Thank you. All right, we're going to take a break, take a bio break. Be back at the top of the hour. We're going to talk about preventing elder abuse with Detective Ashley Turner. And so really more good stuff to talk about.
Yeah, being aware. Thank you, Mark.
Thank you.
Sarah.
Thank you. Thank you.
Out. We're done.
Okay.
Okay.
Yeah.
Moving everything up on my end.
Me too.
Don't look at me.
It's Bill.
Don't look at me.
Who is that? I know that masked man.
Yes. Oh,
There's
there's
the green horn that's
it's on.
is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The 3 most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com. What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com.
Man, we've really gone through some important stuff, and we really needed to spend a lot more time on each of those. And we're going to do that again in this session. We're going to get started, and we're going to find out there's just not enough time to cover everything because there's a lot of really bad people out there. Did I say that correctly, Detective?
I think so. I think that's the politically correct way to say that. Yeah, absolutely.
Thank you. Thank you. Just a reminder, this is our second annual No Place Like Home symposium, and the concept was to help people age in place, which is not as easy as it sounds. A lot of people, I'm just going to live in my house, and it isn't quite that easy. So today we're talking about how to prevent a few catastrophes and maybe prepare. And right now we're going to be talking with Detective Ashley Turner of the Major Crimes Division. Did I say that right?
You did.
With the Ada County Sheriff's Office.
Correct.
And you've been doing this for a few years.
I have. So I've actually been a sworn officer for over 9 in 3 different jurisdictions, 2 different states. And currently I happen to be a detective with the Major Crimes Division at Ada County Sheriff's Office.
Oh, very good.
Yes.
Oh, hang on. I was going to ask one thing, and then please finish that.
Sure.
Which was the most interesting jurisdiction to work in?
Oh, so probably my first. I came originally from Bakersfield, California. That's where my training began. So there's a lot of very exciting professional things that happen there as law enforcement. So, yeah.
Okay, so not that we're boring here. Okay.
No, it's actually much more peaceful, which is good. It's good for my sanity, if you will.
Yeah, well, I'll bet it is. So your educational is interesting, a master's degree in mental health counseling. That's interesting. And then you moved into law enforcement. I'm sure that's a great background for law enforcement, though.
It is. So originally I actually had started my master's degree program while I was living in Bakersfield, California. And I was actually doing a lot of my internship hours and things like that while as an officer. So I got a really interesting opportunity to be able to see things on both sides of the spectrum, both in uniform and then also as a civilian out of uniform, and working with a lot of domestic violence and sexual assault victims. And things like that. So it definitely has helped kind of shed some interesting perspectives for me throughout the years to kind of understand things from different viewpoints.
And now you've kind of settled into the older community, the seniors. And I'm just reading this. Investigated many cases where the victim experienced fraud, extortion, online scams, dating scams. Now that one just, oh my gosh. As well as other types of manipulation style crimes. Man, my personal opinion is that there's a special place in hell for folks that take advantage of our older community. And I know that you probably can't offer up your opinion on that, but that's where mine is, because they're horrible people.
There are lots and lots of bad people in the world. I don't see a lot of the good ones, but sometimes there's definitely a lot of bad ones out there for sure.
All right, so and I know that this has got to break down a couple of different ways. There's the financial abuse, and we'll talk about this, I'm sure. But that isn't just this third party, somebody we don't know, never talked to. That can be family that can commit financial abuse. And then there's the physical abuse, which is often somebody close to them. Did I say that right?
Yes, correct.
So tell us about either or. Actually, talk to us a little bit about both. I mean, in general, you mentioned some of the things that you saw over here, the manipulation. I've talked to people that got the phone call about the grandson in Mexico and he needs some money so he can get back, and they gave him money, and at that point it's a little bit late. But what else? Talk to us a little bit about the financial.
So, I mean, first I want to say, I know I didn't address this earlier. I apologize for the background and things like that. I have some sick kiddos at home, so this is not quite the environment I was going to communicate with everybody in, but I apologize for that.
No.
So the way that we deal with things in Idaho, elder abuse is really challenging sometimes because it can kind of transcend both the criminal and the civil spectrum. And so what I mean by that is sometimes with the financial crimes, it can end up, even though there are people involved that are taking advantage of the older adult, or even taking money from them, it could end up being a civil situation as opposed to a criminal. And that's really difficult for people to sometimes understand. And so I'm kind of all about education. So hopefully I can kind of explain this. In Idaho, we have to go based off of what a quote vulnerable adult is. And so what that means, and whoever is interested in looking up, the legislative Idaho criminal code, it's 18-1505, just in case people are interested in kind of doing your own reading and research. But ultimately what that is any adult that's over the age of 18. So that could be anywhere from someone with developmental disabilities all the way to someone that's in their, older 80s, 90s, et cetera, who's essentially unable to protect themselves from abuse, neglect, exploitation, anything like that. In order for us to be able to prove that, generally it's, okay, they have dementia, or they have early onset Alzheimer's, or they have a caretaker that comes to their house and helps them with their physical needs. So we as law enforcement have to be able to articulate where that vulnerability comes into play so that we can get to the abuse part. I know that's a very vague explanation. So when we talk about the financial crime side, yes, you definitely get a lot of the telephonic scams. And generally, this is a really, unfortunately, great population to utilize that for bad guys because they're generally the ones that have landlines. So a lot of these scams are done through landlines, not so much cell phones. Even though, you and I and everybody kind of gets those scams on cell phones and things, landline's the best way.
Now, because some people will not pick up on that right away. Why is that? Why is it best on a landline?
So, number one, it's easier for the bad guys to get a list of phone numbers. So they can just essentially tap into whatever network they want, get a list of phone numbers, and then they do kind of what we call buckshotting. So they'll just call a bunch of numbers, because it is a very organized type of crime, and they always get at least a few. And it's not always, hey, my grandparents in jail. A lot of times it's, hey, you have a warrant out for your arrest.
Oh, that's another one. Yeah.
And if you don't pay this, then you're going to go to jail. And that's obviously for those of us that are a little bit more aware of the scams, know that that's a scam. But for someone who's older, has never been in trouble legally before, that's a terrifying concept. So they will absolutely abide by that. And the bad guys generally will actually stay on the phone with these people the whole time. And what I mean by that is they'll call the landline first, generally, kind of lure them in with fear, whatever that fear scam is. And then they'll get their personal cell phone. And then at that point, they kind of direct them, okay, I need you to go to, where's your closest Walmart?
Right. Yeah.
And then they'll direct them there, but they keep them on the phone, because the last thing they want is the cashier asking, well, why are you getting a iTunes gift card for $3,000? That doesn't make sense. So they give them a backstory. So there's a lot that goes into play with these online frauds, and I've seen more than once where folks have actually lost their entire life savings.
So can I ask a question right there? 'Cause
Absolutely.
that is really interesting. Is it, I can see the need to keep them on the line. Is that a fairly effective strategy for someone, is to just get off the phone?
Yes, but they won't stop calling is the challenge as well. So even if someone's like, I need to talk to my grandkid about this, or my kid about this, this seems kind of weird, and they hang up, the person will not stop calling. They will continue to call. So sometimes it might be helpful to have the younger generation step in at some point, answer the phone and say, hey, I'm contacting law enforcement. You better stop contacting them right now. And it's more of a fear tactic on our end, right? Because we're probably not going to find these people. They're all fake numbers. But at least they know, okay, this person is not alone, and they have a support system. And like they don't really want to go down that road.
There was one other thought. Hang on just a second. So getting off the phone is perfect. And is the thing that causes the continuing phone call is that they picked it up in the first place? They picked up the call, and now they've talked to him, so they're now going to call again and again.
It's kind of like, it's exactly like fishing. So if you're a fisherman, I don't know if you are, you put the line in and you get that little nibble, but then the fish doesn't quite fully bite, but they know that it's there. So they keep calling and calling, hoping that the fish will bite all the way, just as long as the lie becomes better. So they kind of just expand on the lie as they get better, and they are generally very good at it.
And so caller ID would be very helpful.
Generally, yes.
Which is probably one of the reasons why the landline is so good, because there's not as many caller IDs on landlines.
Yep, that would be a good way. As well as, I know some people will have, their grandparents or whatever screen phone calls, and then it'll go to voicemail. And if it goes to voicemail, they don't generally leave a voicemail.
Yep. Well,
and then they just have to call back. So it's an option.
So that was the conversation I had many times with Mom, was, Mom, that's why you have a cell phone. You can just let it screen, let it be your receptionist. You don't have to talk to them. Now, she didn't believe me because she's of a particular generation, and, she needs somebody to talk to, which, of course, is what they count on, right?
Absolutely.
They're not getting your generation, because you can absolutely ignore a phone call. Even if you know it's Mom that's calling you, you're going to ignore that. So don't talk to Mom. but ignore all the rest. That would be perfect. And so I can see that for the landline. So caller ID would be fine. And even if you don't have caller ID, just let the dang thing go to voicemail, right? Just don't even
Yeah,
worry about it. Let it, and then you can call them back.
right. And I'm generally a proponent nowadays of no landline, to be honest. Because generally the only people that are calling on a landline are people who are trying to scam you, or buy something from you or sell something to you. But the people who are close to you and in your support system and in your network, those people are going to call your cell phone
That is
if you
true.
have one.
Absolutely true. So
So
we
I
still have
generally try to do that.
yeah, and I can appreciate that. We still have a landline, and this week, every morning this week, a phone call at 8 and a phone call at 8:03. And they're Idaho numbers that we know don't really exist, but they're coming from North Idaho or some little town in Southeast Idaho. And they're not really there, right? They're not located in that. They just have that phone number. And my dear wife called called back on one to opt out of a particular service, which I think is why we still keep getting those phone calls. But that would be best. Just kind of ignore them and then pick up the phone message. Got it.
I would.
Yeah. What else? What else do you see as far as a financial scam or financial abuse?
So outside of the spectrum of strangers, then you have the financial abuse within the family.
Yep.
And those are the hardest emotionally to deal with, because generally how that works from what I've seen is you'll have, for the ease of conversation here, I'll say grandma for the elder and then
Yep.
kids for the adult kids. So generally you'll have adult kids that don't really communicate very much with each other, aren't that close, have kind of separated throughout the years. And maybe one either takes care of grandma or lives with grandma,
Yep.
and is siphoning money.
Yeah.
And so this ends up being one of those ones where it could be civil and it could be criminal. And so how this works is if grandma signs over when she's of good mind and healthy, if you will, and signs over the rights to, let's say, her bank account. So that person is her beneficiary, is the person who gets to make financial choices for her. Or she gives that adult child her credit card or her debit card to go get groceries for her. And they spend more, or they get extra gift cards for themselves or whatever. Now the other adult child will eventually step in and say, okay, I don't feel like you're taking care of our mom. And now where's all this money? Like how is she spending all of this money? So it becomes on that end kind of more of a civil thing,
Yes.
although we would document it criminally, and it just wouldn't go to the prosecutor's office just for paperwork wise. So they had it. And the reason that would be civil is because grandma voluntarily, even though she's kind of being scammed by one adult child, voluntarily gave over her credit card,
Yep.
her debit card, her financial information, and the person's taking advantage of her.
And so what that results in then is the rest of the family or someone else in the family bringing an action against that person.
Correct.
And alleging that they have not had permission to spend what they did spend. I mean, part of it, yes, but there's additional. And then in the civil courts, that can be rather long and drawn out, and you have to establish that thing called evidence, right? You've got to establish that evidence sort of a thing. And even if you get a judgment, so what? That money is gone, right? Especially if it's the daughter or the son or the granddaughter or grandson who's living with them, and that's all they got. That money
Exactly.
is gone. All right. Well, that's horrible. Thank you for sharing that with us. But that happens a lot.
Happens a lot. And it's because there's so many emotions involved, it's very difficult sometimes for people to understand, why isn't this criminal? They're obviously taking advantage, and 100% they are. I wish that if I could hold everybody who took advantage of those who cannot protect themselves accountable, there would be a lot more people in jail. I promise.
Yeah.
But in those circumstances, it becomes very difficult. So the parent or the other kids that want to get kind of involved would end up having to do some, again, on the civil side, bringing attorneys in and trying to establish, basically take that person off as the beneficiary and them gain the beneficiary responsibilities, which can sometimes be very tedious and challenging in general. So at that point, you kind of have to bring the masses of the family together and start kind of implementing your own stuff, or bring attorneys and things like that.
Yeah, it's we see this from where we see it. It is when that has happened, they have not had an attorney involved in the planning process from the beginning. It's almost always a do-it-yourselfer. And if, Mom, if you just put me on the account, then we don't have to go to court or anything like that. That, like I said, that means that there wasn't an attorney involved in the first place, because there's a whole raft of issues that you need to go through in order for Mom to make a good decision about that.
Yep.
And well, anyhow, I can go on about that. That's what we do, is trying to help Mom or Grandma take care of themselves so that they aren't being taken advantage of by, one of their kids or grandkids. Yes.
Exactly.
Okay.
So, and that even comes to play when you talk about wills. A lot of times, if you have an adult child who moves in, let's say with grandma, under the ruse of, I'm gonna take care of you, but they're actually living rent free, all those things, they can even convince grandma to change the will, and it's not illegal if she's of soundness of mind. And then that starts getting into a lot of family rifts, right? And so that's where this more of the civil stuff comes into play, which generally I try to explain that. The criminal side would be if she was a already that established vulnerable adult. So she's already got dementia or early onset dementia, or something like that. And it has to be, at least she has to have been seen by a doctor, or at least somehow assessed by a professional. And then they're taking that money, taking that credit card, debit card. Then we have, okay, now you're siphoning money from someone who can't make soundness of mind decisions.
Yeah. Okay. So that's most of the financial. What else do you see from the financial side?
Honestly, those are probably the two big tiers, is the stranger and then the interfamilial.
All right, so now let's talk. We'll come back to this, but setting this up, let's talk about the physical abuse, which is in ways way worse than the financial abuse.
And that, yes, and physical abuse, again, with the soundness of mind thing, that always comes into play in this population. But physical abuse can transcend medical neglect. So let's say the parent needs some sort of medical attention or home hospice or home health care or something, and they're not getting it. Or the adult parent or the adult kid, claims, oh, well, I'm their caretaker. I take care of them. But then they're living in, dirty diapers and aren't getting their food, and they're emaciated and anemic and, all of these things, not getting their baths. Those can all be basically accumulated together and eventually charged. So those things that maybe aren't leaving visible injuries, let's say, the best way to do that is if you have an outside adult child who comes in the house and they're like, something's weird, I don't know what's going on here, whether it's a caretaker or a family member, and documenting those and photographing them is important.
It's that weird thing called evidence again. It's that
Correct.
evidence
Yes.
thing.
And it's not something that we tend to think about, right? You don't go to your mom's house and think, I'm going to photograph
Gotta get
that you're
some
in a dirty
pictures.
diaper.
Yeah.
I mean, it's kind of a weird, uncomfortable thing because you don't want to photograph it, but you're not doing it for positive memories. You're doing it to say, okay, on this date at this time I showed up and, she hasn't bathed. I can tell by X, Y, and Z, and her toenails haven't been trimmed or whatever the case is. That way, when you come and see us as law enforcement, it's not, well, there was this one time, oh, and then there was this other time, but you can't say when, can't say where,
Got
we
it.
don't have pictures. It makes it really difficult to gather all of that together. And then we're kind of behind the 8 ball trying to catch up at that point.
And so that's I don't even know what to call that, but that's a non-violent, I guess, abuse. But it could be she's not eating well, dehydration, a urinary tract infection because she's not drinking the way she's supposed to.
Yep.
And I don't know, there's dozens of other things that could be going on, but that we'll call that the non-violent for a minute. And it's not good. Part of that, though, comes from total ignorance.
Sure.
And some of that is because they don't have a skill set. And I suppose that, and I'm not saying this to justify the child, but part of that is mom doesn't realize that they don't have the skill set to do this. And rather than get the skill set, they helping themselves to some food and free rent, and mom, you just take care of yourself. It's not good. But
Well, and it's scary for people to think, oh, I don't want to go into an old folks home. I'm not that person. I would much rather be taken care of by family. And sometimes families like, okay, and they take that as a door opening to kind of an easy prey, unfortunately.
yeah, oh my goodness. And then I suppose, I hope it is not real common, but there's the violent physical abuse. There's hitting or striking or different things that way. And
Sure.
I know it happens. Hopefully, it isn't the most common one.
I would say probably not, but it's also probably the least reported.
Oh, is that right?
And that's because the elderly population tend to bruise very easily. And so as we know, and so sometimes a light grab could manifest itself in very dark injuries and bruising. But that absolutely occurs, and that goes to domestic violence, whether the partner's in the home still and maybe they're both elderly, but they just don't have the capabilities of taking care of the one who's sick. And those are difficult to prove, especially if the victim has been in a domestic violence relationship for a very long time. I've seen that many times. And then you have, the caretaker who's doing, who might be overly aggressive. Maybe they're complaining about pain and they need pain meds, but the caretaker, is physically abusive. And generally, this is not all the time, but generally I don't see just from caretakers, just physical abuse. They don't just hit and strike the elderly person with nothing else going on. Generally, maybe they're siphoning their medications and selling them on the side. And so now the patient is in pain and sick or having symptoms that they can't alleviate themselves, but yet the meds are gone because the caretakers took them. And so they won't be quiet. So in order to keep the person quiet, they use physical violence. That's just one of many examples. And then, as much as people don't like to admit that this happens, there's also the sexual abuse side that happens. And I wish it didn't, but it does. And generally that's from outside the family that might happen. And then you have, just generally some striking and things like that. Those are sometimes very difficult to prove as well, especially if the victim is nonverbal.
Yeah.
And all you have are visible injuries because of the way that the elderly population bruises generally. That's not all of them, but I mean, it's the circle of life. As we get older, we bruise easy. So it becomes very difficult. I've had many cases where I've seen some pretty bad injuries that I believe personally are something, but proving that is a completely
Yeah.
different.
Yeah. Hey, just kind of curious now. The what we're trying to do in our conference here is talk about people who would like to age in place or stay in their homes. And we're all for that. We'll help them to do that, but there are some standards we think ought to be met, and safety is huge on this. Let's see. I'm going to ask it, and then you can explain it. Isn't that great? I get to do that.
Get the easy part.
Yeah, I got the easy part. Does the physical violence, does that happen more at home than it does in, say, assisted living or memory care, or does it seem to matter one way or one place or the other?
So what I've seen it, at least in my career thus far, it's been at home.
At home.
And it's when the other family members are not there. So a family member will be working and they'll have a caretaker in the home. And when the adult parent or the adult kid comes to check every day on their mom or dad, trying to be the good child, and they notice new bruising and they're like, Mom, what happened? They may or may not be able to explain. And so this isn't like abuse where, you know, the adult child's in the room and the caretaker is just punching their mom. That's not how this works. It's a very discreet, kind of a shut them up, for lack of better terms, way to do things. And it, because of the fear that's involved, because the caretaker is alone most of the day, with the older person,
Yeah.
there's a lot of fear there because they know they can't take care of themselves and they have this pending violence over their head. But then if they tell their grandkid or their child or whoever comes and checks on them, the fear of retaliation is so much more frightening than just essentially taking it. So it becomes a very difficult thing.
So, I guess break this down a little bit. What do we look for? Right?
So, yeah.
If we're dealing with mom or dad or whatever, what from both the financial and then from the more physical, what are some things we should look for?
So I would say if we're gonna hire a caretaker, let's go the caretaker route. You're gonna get what you pay for, unfortunately, generally. So if you go with, I'm gonna save money and go with the cheaper business that has home health people to come in my home, you're probably not gonna have as high of a standard of employment than somewhere that you might be paying a little bit more. On top of that, I would absolutely require not only the employer to do background checks, but I would probably do my own research as well, being the adult child. So figure out where that person has lived, whether that's California or Idaho or whatever. And most criminal court cases are public record online now. And they should be able to go look up the person's first and last name, get their birthday. And if the company is like, we're not going to give that to you, then you know what? Okay. I have to make sure that my parent is safe. And I want to see what kind of criminal record this person has for myself so that I know that I'm not being, duped myself.
So what if somehow we got somebody that got past that? And like you said, you walk in and this isn't feeling right. There's something. What should we be looking for?
There's so many things, and I could go through all the behaviors that people would notice. But my main thing that I tell people is trust your gut and your intuition. If you walk in and you meet somebody who's supposed to be taking care of your family member, and your gut or your intuition says, oh, something's wrong here, even if you cannot articulate it, it doesn't matter. You have to go with your gut, because something instinctually within you is telling you something's weird here. I don't know what it is, but there's some alarm bells going off. Don't just let it go until things get bad. That would be my personal recommendation.
So what would you suggest at that point? I can see perhaps you don't have enough evidence to do something about it, but you could certainly terminate that relationship. You hire somebody, it's not forever.
Right. Yeah, you could terminate with that one. If you're going through a company, you could request a different person. And generally they'll ask, well, why? You know what, there's just a personality conflict. I think, maybe we need a different person in here. And you don't need to get into it. You don't need to get into, well, my gut says this person's a weirdo. Just say, it's just not going to work out. And, I'd appreciate a different person to be the caretaker. And so again, if the business is not amenable to that, then find a different business, because they're working for you.
Okay. So now it's a family caregiver. What should we be looking for? And this is more difficult because your gut it's not maybe as reliable, but yeah, I still got somebody in here and there's something going on. What should I be looking for? I mean, other than bruising.
Right. Are you talking about with the suspect, if you will, or the elder?
Yeah,
Both.
so I come in and I've got a sibling or a grandchild that's providing the care, the caregiving. And again, I'm just not. There's something here that's going on. What should I look for? What should I look at?
So usually, if the person is bedridden or just in general, ask questions. If they can communicate on any level, the person who's receiving care, communicate with them one-on-one outside of the scope and the hearing of the other person who's been giving them care. That way, if there is some fear there, that's gone. So you can send that person on an errand. You can send them to the grocery store so that you can have a one-on-one talk. Bruising is obviously always, important to see. And if the story from the caretaker is not aligning with a rational reason as to why that injury is there, then you need to really start questioning that. It's kind of like if you have children and your child gets a bruise on their forehead and you're like, well, what happened? Oh, well, they, little Johnny fell and hit his head on the coffee table when they're trying to walk. Oh, okay. It's not a hesitation. You know how to explain it. You know what's going on. So if there's a hesitation there, for example, one injury I saw, the woman had very thin skin at that point in her life. She was on home hospice. And it was a domestic violence type situation. And a lot of her skin on her forearm had been peeled off because of a physical assault that happened. And the reason was, well, she has a medical bracelet on her wrist, and that must have done it. No, that doesn't happen. That's weird. Those are very loose unless you're digging. That doesn't make sense. Could it? Sure. Is it probable? No. So when you're hearing the story, ask the caretaker questions too, away from the person getting cares things. So if you're seeing things that are weird, or even if your spidey senses are up and you just are like, oh, okay, what'd you guys do today? And just start with those general questions. And if they're like, oh, nothing, you just stared at the wall all day. Ask questions. That's your right and responsibility. And if they can't tell you, and it seems like they're hiding something, then ask more questions.
Yeah, this is not fun stuff, is it?
No, and hopefully I'm answering your question. I tend to talk a lot, so I'm hoping I'm.
No, you're exactly right on for what I'm asking, because, again, we will support clients in their desire to stay at home. But one of the standards that they have to meet is being safe. And
Right.
so this is huge stuff. We haven't seen a ton of it, but that doesn't mean it isn't happening. It just means we need to be very, very vigilant about what we're seeing. Okay, so let's shift back to the financial side. Any thoughts? What can we be looking for or asking about? What are, some of the suspicious activities? What do you got?
So in the cases that I've seen, even when I come into play, and as soon as I come into the picture, a lot of times the adult kids may not know what's going on yet. And so I tend to make it very common practice for me to call them after I'm done with the victim and let them know, hey, didn't know if you knew this, but now your father is completely out of his life savings because of this situation. And they're always shocked, right? Because they don't want to share, and it's embarrassing, and they feel shame. And at some point they realize, wow, I messed up and I have never done anything like this before. And I'm like, they feel very stupid, and they're not. It's just, this is these people's job. Their job is to take advantage. So I'm always a proponent that at some point, if someone wants to live on their own and they're older, to maybe allow one of their adult responsible kids, if this is even possible, or even like a financial attorney or something just on the back end, just to keep an eye on stuff. Not to necessarily go spend money for them or make financial decisions for them at that point, but just to keep an eye so they have access to the bank accounts. Because if you see even one charge for $2,500 for an iTunes gift card, that should be an immediate, okay, we need to shut things down. We're going over to their house right now and we're going to have a conversation as to what's going on. Because you're not going to, the story is, oh, I'm buying this for my grandkids. No, you're not. You're sending this to Guam or who knows. So I think having that just visual ability and just the access is really important, not necessarily to make decisions, but just to monitor so that okay, what's she or he spending money on? What are we doing here? I think that's helpful if it's possible.
It would seem to me that the ability to review the books, the accounts, even once a month would help mom or dad to remember that somebody's going to be paying attention and they're going to ask questions. And
Absolutely.
they don't want to go there because they're mature, they can do this, and they don't want to be embarrassed. And yeah.
And it's going to be up to that adult child or grandchild to have that conversation, which can be very difficult because the person that's kind of relinquishing a little bit of that control and power is hard. It just is. And so you need to be empathetic to the fact that this is a huge thing for someone to give away that independence. It's a big thing. And so just explaining, hey, you know what? There's a lot of bad people in the world, and there's a lot of scams that maybe you and maybe I am not even aware of. I just want to look. I'm not going to use your money. I'm not going to spend it. I just want to make sure that everything is okay and no bad people are taking advantage of you, because if so, I'm going to need to step in.
Yeah. So that's kind of a third party. That's a stranger that's maybe taking advantage. What if it's one of the kids?
That one's harder because it kind of depends on how. Usually if there's one in the home, the other kids maybe aren't as physically involved, so they won't know until it's way too late, until things are getting to the point where, okay, now we're looking at home health care, and now we're looking at medical expenses or whatever, and where's all the money, kind of a thing. So that one becomes a lot more difficult. And I think that, I mean, that I don't even have a solid solution for that, because usually there's so many rifts within the family that you have to transcend to be even get past that. From what I've seen, not always, but generally the adult child living in the home who is siphoning money and taking advantage is kind of generally the problem child, and always has been within the family. But it's also generally the kid that the parent has protected their whole life.
Yeah.
So there's a lot of this going on for their whole
Yeah.
lives. So the other kids are like, mom or dad, what are you doing? This kid's always been a problem. You know, they had drug issues or whatever. And you're going to let them live in your house? Are you kidding me? And you're going to let them be the beneficiary? So that one becomes very difficult unless the responsible one can get in before the irresponsible one.
So there's a number of things that we can do from an estate planning standpoint up front that can minimize that. We can make sure that it's not just one child, that maybe there's two that work together and they have to report to each other. And that doesn't completely get rid of the risk, but it minimizes it quite a bit. And then if we have a power of attorney, we can take the stress from mom or dad and say, no, that isn't going to happen. You can't live here. So there are some things you can do and set up beforehand, but you can't. It's a conversation we've had almost all day long, and that is, you can't force it on mom and dad. You have to get them to agree and say, yes, I want to take care of this. And it's
Right.
really easy for them to say that. It is also extremely difficult for them to actually do it. And I've seen that up front a number of times. Well, listen, I really, really, really appreciate your time this afternoon. And again, we didn't have enough time, but that was about all I could handle, talking about these kinds of people that they're not good people. Again, there's, a particular place in hell for them. And maybe we'll go visit and be kind then, but we shouldn't be kind now. We need to protect our parents and our loved ones. So thank you, thank you, thank you. Is there any one thing you want to throw out there as we head out?
No, I know that it's case by case basis. And I know there are probably many people that are watching or listening or whatever that have questions or personal situations where they want to run by it. Please realize that you can always just call the police department, or you can find me. I'm a detective in Star. I'm the only one. I'm not hard to find. And just ask. And any deputy in Ada County or law enforcement should be able to just say, you know what, I needed an officer to call me back. I just want to run this by them because I think it's a little strange.
Yeah.
That's also part of law enforcement's job, is we don't just put people in jail, but we also like to support and educate and help, because there are lots of things in life that normal people don't deal with that are normal for us, unfortunately, that we do deal with.
Yeah.
So if you have questions or you have that weird sense, just call and run it by somebody. If you don't have a good experience, or for some reason that person's not answering your questions, call somebody else. Find me and call me. I'm fine with that. If I can help kind of steer you in the right direction, great. Or they can utilize you, Mark. Anything like that, just reach out to the resources and ask questions. Don't just go with it.
Yep. Thank you. That is perfect. That is perfect. Thank you for your time this afternoon, Detective Ashley, and good luck. Keep finding those bad people.
Thank you so much.
You're welcome. You take care.
Thank you. You too.
Clear? Are we clear?